Good morning, Esther. Good morning, Jeff Draper.
Good morning.
Have a great meeting.
Thanks, you too.
Esther, would you like to do a mic check to make sure everything's working okay? Next Door Solutions, welcome. Thank you. Would you like to do a mic check?
Hi, good morning. Doing the mic check. Can you hear me?
Sure can. Thank you. Have a great meeting.
May I ask for Nextdoor who will be speaking on behalf of Nextdoor?
It will be Esther Perales Digman. She ran off to get some water. She'll be right back.
Oh, no problem. No problem. Thank you.
Oh, and B Robinson too.
Oh, excellent. Thanks.
Good morning, Dawn.
Good morning.
Thank you for being here
Thank you.
and have a great meeting. Good morning, Supervisor Wasserman, President.
Good morning, Rhonda. How are you?
I am doing well, thank you.
Good. And we've got Colin today?
Colin is going to be
I'm
with
here.
clerk today.
Wonderful.
And then just as an FYI, for the next couple, 3 meetings, you're going to have a new host. Mr. Jim Weston is going to fill in for me while I get a new name.
All right. Well, we look forward to being supervised by Jim.
He's going to make it happen.
I have no doubt, but we'll miss you.
Thank you. I'll miss you too.
Welcome.
Good morning, Supervisor Semidian.
Good morning.
Thank you. We can hear you loud and clear.
Thank you, ma'am.
Vice President Ellenberg, I do see you. You'll be leading us in the pledge today. I just got a call of spam risk from Marysville. Supervisor Semidian, is that in your district? I'm kidding you. All right, ladies and gentlemen, it is 9:30.
Recording in progress.
And I see all of your smiley faces. Colin, if you could please lead a roll call.
Sure. We have Supervisor Lee.
Good morning, President.
Present. Supervisor Chavez.
Yeah, here.
Present. Supervisor Semidian.
Here.
Present. Vice President Ellenberg.
I'm here.
Present. And President Wasserman.
Here as well. Thank you
So
very
we
much.
have a quorum.
All right. If those of you that can stand, do so, please. We're going to have the Pledge of Allegiance today, led by Vice President Ellenberg.
I pledge allegiance to the flag
Flag
of the United
United
States of
States of
America
America,
and to the
to the
republic
republic
for which it
which it
stands,
stands,
one
one
nation,
nation,
under
under
God,
God,
indivisible,
indivisible,
with liberty and
liberty,
justice for
justice
all.
for all.
Of course, we have our flags at half-mast today in memory of Colin Powell. All right, with that, we are going to move to Supervisor Chavez, item number 4, and announce an adjournment in memoriam. Supervisor.
Item number 3 for our invocation.
I'm sorry, item 3 for the invocation, then we'll go to you on 4 in the memoriam, then we'll go to you on 5 on the proclamation. There we
Thank
go.
you. So this morning, I'm very honored to introduce our invocator, Kiana Aguia Lebreu. Kiana is a Cebuana Tagalog Filipinx poet and writer, and poet and writer in the diaspora residing on stolen Ohlone Tamian land. She hopes to provide a safe literary space for underserved and underrepresented communities with her magazine, Marias at Sampaguitas. And she is active with the Anuk Ubay on Silicon Valley chapter. She is an accomplished young woman. She is a fellow at the Kearney Street Interdisciplinary Writers Lab cohort for summer 21, as well as the author of a number of chapbooks, Natalie, No Saints, Mohilok, and she even has a 4th book coming out in 2021, Kanu Yitnai. She is currently one of the honorary Santa Clara County Poet Laureates of October 21, or she is, I think you are our Poet Laureate for this month, right? I'm so excited to have you here, Kiana. Thank you so much for being with us today. Welcome.
Thank you, Ms. Chavez. Thank you, everyone. I have the one poem for you all. Maayong adlaw, usag pagampo alang sa mga babaye, a prayer for our women. 1. Stone unmovable, cold, uncut, jackhammer creases ripple and unfold from forehead to shoulders that are beginning to mouth the word no. Gauge the weight of it with hands that want to be more than closed fists to unresponding walls, tracing ceilings with eyes, praying our feet will take us into the next morning. 2. My Lola, who is my grandma, my Lola of her Lola, breathed in the sun. Its rays a tether to her lips, a beast to tame this past from woman to woman. It imbuing her with the strength to lie through golden teeth as invaders demanded she reveal her daughter's black hair, Bisaya skin. She is the mother of defiance, speaking love with her hands and exchanging blows in the next before riding into the hills of tomorrow under the cover of her shadows. 3. I have to learn to arm myself in my Lula's light, to take time without regret, to hold breath in my lungs, to expand into space that I should not have to earn, that which I already deserve. These stones do not break under duress, but are the diamonds of her eyes. The night before she passed, she came to me in a dream, not with promises, but urgency. What was once hers is now mine. She spelled these truths into my palms, and she woke me the next morning as the brilliant sun. Thank you all.
Kiana, thank you so much. That was amazing. And we're so glad you were with us this morning.
Thank you very much. Supervisor Chavez, we now move on to item number 4, announcements of adjournments in memoriam.
Thank you. Today, colleagues, we are adjourning in memory of Saul Wachter. I want to acknowledge his family, Jeff, Doug, and Matt. His sons are joining us today, and I'm so honored they could be here to hear us honor their father. Sal was born in Brooklyn, New York on October 9th, 1917, and he was 103 years old when he passed. He attended NYU and moved to the Bay Area to attend the University of California at Berkeley. And there he met the love of his life, Billy Corral Coleman. Sal graduated with a degree in social work and worked in the field he entered into the military service in 1945, where he counseled returning veterans from World War II. He was active his whole life in progressive organizations, working for social justice and economic justice for working people and all marginalized and exploited communities everywhere. He was a longtime member of the United Auto Workers Union. As a retiree, he was active in the Federation of Retired Union Members, which we refer to fondly as the Forum. Over the years, Saul and Billy were active in the San Jose Peace Center and in PACT, People Acting Together, just two of several organizations they supported during their almost 50 years together in San Jose. They were especially proud of their work with the Affordable Housing Network in San Jose, an organization which they helped found and for which they provided leadership for many, many years. And much of the work that you see in San Jose and in Santa Clara County is directly related and rooted in that organization, the Affordable Housing Network, which was established before people thought affordable housing was a problem. Sal frequently spoke at public meetings, including San Jose City Council meetings, Santa Clara County Board meetings, successfully advocating for the building of thousands of affordable housing units. Saul, and many people didn't know this, was a man of many talents. As a young man in Berkeley, he acted in community theater and was invited to join the Jose Greco dance troupe, which I didn't know that about him. He was a do-it-yourself craftsman who single-handedly remodeled the family kitchen in Berkeley, building all of the cabinets in that home from scratch. He was universally seen as kind, funny, and a gentle man, very devoted to his late wife, Billy, who we also loved dearly. He was a tireless activist for social justice, and I know that even in his kindness and sweetness, he could be fierce and determined. Billy and Saul are going to be sorely missed, and Billy will continue to be missed, and I want their sons to know what a huge impact they've had on making sure that many, many people in our community have access to housing that wouldn't have but for them. Thank you for letting me share this adjournment.
Thank you, Supervisor Chavez. Board members, we now move on to item number 5, commendations and proclamations. And we're going to start with Supervisor Chavez, who's also adding 64B and 64C onto this item number 5. Supervisor.
Thank you so much. Today, I'm going to start with presenting a commendation to recognize the Diwali festival as a holiday of significance. We have here Isan Kathiar, California Advocacy Director for the Hindu American Foundation, who's joining us today. Welcome. As many of us know, Santa Clara County is home to several 100,000 South Asian American residents. The Diwali festival has great significance to Indian Americans and South Asian Americans and is celebrated around the world by Hindus, Jains, Sikhs, and Buddhists. Diwali is one of the world's oldest religious holidays, bringing together family, friends, and communities here in California, the United States, and around the globe in goodwill, peace, and a shared sense of renewal. Diwali is commemorated as the festival of lights, during which the celebrants light oil lamps and place them around the home and pray for health, knowledge, peace, and universal well-being. While Diwali is celebrated according to the diverse customs of its many celebrants, Hindus believe the lamps symbolize the light of knowledge and truth within the individual that signify the destruction of negative qualities and the triumph of good over evil. It is celebrated as a day of Thanksgiving as well as the beginning of the new year, and celebrates renew the commitment to upholding values of truth, peace, and restraint through their thoughts, words, and actions. This year, Diwali falls on Thursday, November 4th, on the lunar calendar, and I'm privileged today to honor the Diwali festival as a holiday of significance in strengthening the Indian American community through the celebration of culture, heritage, and family. Isan, thank you for joining us. I'm happy to turn this over to you.
Thank you, Cindy, and good morning, President Wasserman, Vice President Ellenberg, and Supervisors Lee and Simitian. And thank you, Cindy, for sponsoring this beautifully written commendation, which explains Diwali better than I could. It's the Festival of Lights, the biggest holiday in India. And we certainly appreciate the Board of Supervisors and staff for recognizing it here in Santa Clara County, where we have, of course, significant populations of Indians who are Hindus and Sikhs and Jains, celebrated by 1 billion people around the world. So thank you again for your traditional inclusiveness of our diverse population. I'm, yes, the California Advocacy Director for the Hindu American Foundation. We're a advocacy-based group in Washington, D.C., been around for 18 years and speaking up for the 3.2 million Hindus in America. So thanks very much, Cindy and everyone.
Thank you.
Thank you for joining us.
Supervisor Chavez, we move on to you next for item 64B.
This is the recognition of Nextdoor. Okay. Thank you so much. And today I have the privilege, and I'm so excited to see Esther and B and the whole crew from Nextdoor. We can all see you online. We have the privilege of presenting 2 commendations. One is to B. Robinson for her half-century of advocacy on behalf of survivors of domestic violence, including founding the organization that became Nextdoor Solutions to Domestic Violence. The second commendation is to Nextdoor Solutions to Domestic Violence that will be presented to Esther and her team for their continual work protecting, nurturing, and supporting some of the most vulnerable members of our community. In 1971, B. Robinson Mendez recognized before almost everyone else that victims of domestic violence and their children lacked a safe place for refuge and support when they fled their abuser. Thanks to her grassroots effort, the perseverance, the Women's Alliance was founded in 1974, and it began providing charitable and education services for domestic violence survivors, particularly those from the Latina community. In 1989, WOMA became Nextdoor Solutions to Domestic Violence. Currently, they respond to over 15,000 crisis calls a year, 15,000 in their hotline. I want to thank Bea so much for her leadership and her work, and we're virtually presenting this to you, but we will get this to you in person. And thank you so much for your leadership that really brought us where we are today. Nextdoor Solutions to Domestic Violence had the humble beginnings of so many organizations, and it first began in actually in a garage, in Bea's garage. Thank you, Bea, for lending that to us. This garage shelter, set up in 1971, was only the second domestic violence shelter in California. Today, Nextdoor Solutions to Domestic Violence provides services to approximately 2,500 people each year, moving survivors and their families from crisis and violence into safety, stability, and self-sufficiency. They were the first domestic violence agency in the nation, the very first to offer bilingual services. During the past 50 years, Nextdoor Solutions to Domestic Violence has faced many challenges in their struggle to end domestic violence and assist survivors. But the challenges in 2020 and 2021 have been some of the most daunting. The COVID-19 pandemic forced victims to shelter in place with their abusers, and it became difficult to offer services and assistance. However, the organization successfully rose to meet those challenges. Throughout the pandemic, their operations never stopped. And I just want to say one thing about how they built so much trust with the community, that people who had concerns, not necessarily about domestic violence, but were worried about food and shelter and how they were going to survive, reached out to Nextdoor early in the pandemic for help because they were such a trusted partner in the community. We really are here to honor you, Nextdoor Solutions to Domestic Violence, for being true champions of the most vulnerable in our community. And a sincere thank you, Esther, to you and your entire staff for the leadership and work. And again, a virtual commendation that will be coming to you in real time. So Esther and Bea, we wanted to give you a moment to share your thoughts.
Go right ahead.
Hello, how are you all? This is my first effort at Zoom, so please bear with me. I also am honored by your attention and the significance that you have paid attention to, the work that Nextdoor does with its wonderful staff, with a wonderful board of directors who are very involved, to a community who has supported us and paid attention to our efforts. And that's why we have the recognition that we're receiving today. I think that nonprofit organizations serve a most valuable service to our community. And Nextdoor is a prime example of how hard work, honesty, and truthfulness can get you there. Thank you again. Bye.
On behalf of Nextdoor Solutions team and the Board of Directors, we want to thank the Board of Supervisors for your unprecedented levels of gender-based violence. It has been a historic couple of years seeing that fund increase. We will continue to operate, and we are here for anyone that is in need of our services 24 hours a day, 365 days a year. So again, very grateful to the Board of Supervisors and especially grateful to the staff of Nextdoor Solutions. Thank you for the accommodation.
Thank you. Well done. Supervisor Chavez, thank you very much. Supervisor Committee, before we move on to...
Actually, President Watson, may I say a couple of words?
I was just going to say, Supervisor Committee, if you can wait a minute, I just want to recognize Supervisor Lee first.
Thank you.
So Supervisor Lee, go ahead.
Yes, I just want to also congratulate the entire board of directors of Nextdoor Solutions to domestic violence on this 50th anniversary, and particularly to B. Robinson Mendez for your vision of this unmet need in our community half a century ago. Domestic violence still occurs in all our communities, and we know that it happens within our families, amongst our friends, across the lines of race, gender, sexual orientation, and all level of socioeconomic status. Intimate partner violence occurs among married, cohabitating, and dating relationships. As a father of 3 girls, I truly worry about the physical and emotional safety. We have to continue to raise awareness to stop the violence. Enough is enough. Hitting is not love. Yelling is not love. Saying sorry afterwards does not make it okay. These are assault and batteries, and these are crimes. We must believe in domestic violence for survivors and hold the perpetrators accountable. And as a county, we will continue to work with all the advocates to improve our systems. I look forward to working with Nextdoor Solutions for another 50 years in support of your survivors and all the great work they're doing. Thank you so much.
Thank you, Supervisor Lee. And Supervisor Simitian, before we move on to you, I'm just going to announce that after Supervisor Simitian does his proclamation, we're going to go to item number 6, which is public comment, which is an opportunity for anyone to speak about anything not on today's agenda. If you wish to do so, please register by raising your hand electronically so that Colin and I can manage the meeting better. Thank you. Supervisor Simitian.
Thank you, Mr. Chairman and colleagues. By our actions today, we join folks across the country in declaring October Breast Cancer Awareness Month, and in so doing, of course, hope to bring a greater awareness to the significance of breast cancer here in the United States. The numbers are the statistics, but compelling. 1 in 8 women in this country will likely end up developing breast cancer sometime during her life. It is the 2nd leading cause of cancer deaths in this country. But on a more personal level, I have to tell you that a decade ago, when I worked on breast cancer early detection in the California State Legislature, I was struck as I talked to my colleagues that everyone had a story. Person after person had the ability to understand and empathize because they had been through it themselves, or a family member had been through it themselves, or a dear friend had been through it themselves. Regrettably, this is a pervasive challenge, not only here in the United States, but abroad as well. And we proclaim October Breast Cancer Awareness Month to foster that greater understanding and awareness, but also, and I want to underscore this, to take a moment to recommit ourselves to the work that we have to do and the work that so many good folks in so many good organizations have done. It isn't enough simply to be aware. We've got to fund the research. We've got to improve our detection methods. We've got to make sure we have top quality staff, as we are fortunate to have here at our VMC and elsewhere in the county, who are equipped to deal with the challenge that breast cancer presents. We've then got to make sure that we have the support systems in place to help people through what will be perhaps one of the most challenging chapters of their lives. So in addition to recognizing October as Breast Cancer Awareness Month, I'm really very pleased that we're able to incorporate and include in our recognition today the work of 5 groups, the Pink Ribbon Group, also known as Pink Ribbon Girls, Cancer Care Point, Latinas Contra Cancer, Bay Area Cancer Connections, the American Cancer Society. I'm sure there are others, but these 5 groups have just been doing extraordinary work. And we're pleased to have 3 of them today. And I want to give each of them a moment to weigh in, Supervisor Wasserman. Folks from Pink Ribbon Group, from Cancer Care Point, and Latinas Contra Cancer. Some of you will recall that last year we were able in our budget to find some funding to bring Pink Ribbon Group into Santa Clara County. That they were a new provider for our county, and to up, if you will, the resources available for Cancer Care Point, who had been serving us for a very long time. Both organizations are there with the kind of day-to-day support that a patient needs, a survivor needs. It's things as basic but challenging as transportation, meals, and of course, Latinas Contra Cancer has been a special resource in terms of making sure that there is cultural competency in the way these kinds of services have been and continue to be provided. So I wanted to say thank you to all 5 of these organizations, give a few of them an opportunity just to tell us a little bit about their work and their relationship with our county. But as I began, I want to close my remarks by saying awareness is a start, but it isn't enough. The question is, what will we do? What will we do in the face of a challenge like this one? And these are people who are doing. And let me say thank you. Let's, if we could, through the chair, start with the folks at Pink Ribbon Group, Pink Ribbon Girls.
Right ahead. Thank you.
And I believe there we are.
I am here. Thank you so much for this recognition and this partnership. On a personal level, just the commitment and the compassion of the Santa Clara County Board of Supervisors makes me very proud to be a resident of Santa Clara County. Professionally, as a representative of Pink Ribbon Girls, for the period January to September 2021, we've already provided 12,325 meals and 338 rides to Santa Clara County breast and gynecological cancer patients, many who are food and ride insecure. And while we have immense gratitude for Supervisor Simidian for recognizing the alignment of PRG and SCVMC's missions to reduce the burden of illness, I want to use this opportunity to also thank all of the county leadership, the physicians, nurses, and other staff at VMC, as well as the patients who become our clients, for all your hard work on behalf of our shared community. Together, we are making a huge difference. Thank you very much.
Thank you, Mr. Chairman. That was Julie Arnheim, of course, from Pink Ribbon Girls and Pink Ribbon Group. Let's turn then to Cancer Care Point, who I believe is on my screen. There we are. Hi, Dawn. Good morning.
Thank you. Thank you so much, Supervisor Simidian and the Board of Supervisors, for the commendation and recognition. We could not do our work of transforming support for cancer patients, survivors, family members, and caregivers without your support and the support of the community. I also want to thank the VMC leadership, the doctors, nurses, patient navigators, and social workers who not only take care of the medical needs of those impacted by cancer, but who also take the time to connect patients to services and support available to them, like Cancer Care Point. Since the beginning of the year, we've had 125 direct referrals from the staff at VMC. And working together, we will continue to make sure that all impacted by cancer are supported and that no one has to face cancer alone. Thank you very much.
Thank you, Don.
Thank you, Mr. Chair, and I believe that takes us next to Darcy Green with Latinas Contra Cancer.
Hi, thank you so much, Supervisor Simidian, for this recognition. I'm here with our board chair, Carla Perez, who is our board chair and also a breast cancer survivor. Thank you, Supervisor Simidian and honorable members of the Santa Clara County Board of Supervisors for this recognition of our work, but also this recognition of the clients we serve. Clients who right now are struggling to navigate breast cancer and also the economic burdens of living in this valley. This is, I believe, our 12th year of partnership with the County of Santa Clara, either directly through the Board of Supervisors or through Valley Medical Center. With your help, we are working every day tirelessly to help low-income cancer patients stay housed, stay fed, take care of their families, and stay connected to Valley Medical Center and our clinic systems. And I just appreciate so much, Supervisor Simidian, what you have said around it's not enough to be aware, that we also must do something about it. I'd like to take this moment just to stress that the need out there for low-income cancer patients, for Latina cancer patients, is desperate and urgent. And I'm proud to live in a county where our leadership has recognized the need to end race-based health disparities and to do what we can to make sure breast cancer patients are not alone in this fight and have what they need to prioritize their care. At Latinas Contra Cancer, we will continue to provide services for the low-income cancer patients, for communities of color, for undocumented communities, and those who are facing the risk of homelessness. And we wouldn't be able to do it without your support. So I know Supervisor Lee, Supervisor Chavez, thank you for spearheading and leading the call for funding for our organization. And I thank the entire Board of Supervisors for the support and the recognition that you've given our organization. And again, more importantly, the clients who we serve. Thank you.
Thank you, Mr. Chairman, and thank you, colleagues, for taking the time to provide this little bit of well-deserved recognition. And thank you so much to the providers who are taking that awareness, as I say, and doing something with it. So much appreciated. And I'll just close, Mr. Chairman, by channeling my inner advocate and say, I know we'll all be mindful of the need when it comes time to look at our budget again this coming June.
Sounds good. Thank you. All right, with that, we move on to item number 6, which is public comment. As I stated previously, this is the opportunity for anyone to say anything about anything not on today's agenda. And given the number of people that are currently registered, Colin, we're going to give them 2 minutes each to speak.
All right. The next speaker is Robert Terriquez. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Oh, 1 moment, please. My screen just went wacky, but here we go. Robert, are you there? Robert, you have your hand up. Your mic is unmuted. There you go.
Hello.
Go ahead.
Very good. Good morning, everyone. Thank you for the opportunity to speak. My name is Roberto Terriquez. I'm a lead officer for Protective Services at the Health and Hospital System. I have worked for Protective Services for over 18 years. I have worked at all the clinics in the Health and Hospital System, as well as Valley Medical Center. I worked in the capacity of a Protective Service Officer, a lead Protective Service Officer, a field training officer, working out of class supervisor, PSO, and a dispatcher. I'm currently working a swing shift Protective Services Officer spot at the East Valley Clinic. In the years of service, I, along with my coworkers, have provided the safety and the security of the county staff, patients, visitors, and property. We have prevented assaults, injuries, vandalisms, burglaries, and even deaths. We saved kids from being stuck inside locked vehicles. We even delivered babies. We've convinced patients to not harm themselves or others, and overall keep the quality of the establishment high for everyone that visits us. Lately, our union presented us with the proposal of eliminating all the PSO positions and turning us into a sheriff security officers. With this proposal, it states that everyone has to pass a background check and a polygraph test. So this is interesting. It just raises concerns for a lot of us at PSOs. They're also going to combine all the protective service officers in the social services department and the libraries along with us. Our concern is if unnecessary changes are made to our department, this could compromise the way we operate and consequently have us all fail to provide the services we do now. We request transparency of a proposal of us becoming sheriff security officers. Request that we could view the proposal.
Next speaker is Sharon Luna. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good morning, supervisors. This is Sharon Luna. I'm a resident of San Martin and also on the San Martin Neighborhood Alliance. We have noticed on social media that residents of San Martin, Morgan Hill, and Gilroy often express concerns about how development is taking place in their respective towns and feel that their voices are not being heard. What we want to do is we want to join forces together that will take this negative and to a positive. And what we are asking is to have the South County Joint Advisory Committee reinstated. This committee is an active committee on the meetings. It has been in existence for many years, yet has not met since 2017. It has never been officially decommissioned. The purpose is a joint venture between the three towns. We are asking our members and Morgan Hill residents and Gilroy residents to send letters in to get this committee reinstated, but not necessarily as an advisory, as a commission. That way we can work together with county officials, with the mayors of Gilroy and Morgan Hill to be a positive committee, to get things done, to hear our voices and basically work together and see what we can do to help the residents down here in the South County. Thank you for your time.
The next speaker is Lauren Teixeira. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
All right, thank you so much. I'm just recently retired from serving 26 years for the Santa Clara County as a children's librarian. And I just wanted to say I don't qualify for hero pay because I did retire on September 7th of this year. After 26 years of being a children's librarian, devoting myself to that work and serving 12 months as a disaster service worker from May 2020 to June 2021 during the height of the pandemic. I served as contact tracer and as a vaccine worker at Levi Stadium. I put off my retirement to serve as a DSW, but I don't qualify for hero pay because I did retire on September 7th, 2021. I'm grateful and feel honored to have served my communities in Santa Clara County. I thank you for your service and I thank you for listening to me today. I just felt like I wanted to bring this up to you because it was quite a challenge to be a DSW. I left the comfort and the joy of my career as a librarian to serve the community, and it was not easy sometimes. In fact, it was very challenging. I do feel grateful. It was a tremendous experience, and I feel very glad to have had an opportunity to contribute in that form or fashion. But I just wanted to bring that to your attention, and I do thank you for your service, and thank you again for listening to me today.
Next speaker is Tino. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, good morning. I want to bring to the board's attention the fact that Moderna was recently paused in 4 countries for younger groups under 30 years old: Sweden, Denmark, Iceland, and Finland. I want to ask you a question. Is the Pfizer approved formula actually being used in the United States? If so, why are we still using other shots under emergency use authorization? And if that approved formula is not being used, why isn't it being used, and why isn't that being reported? I ask that the board get to the bottom of this situation immediately. I know there's a health and hospital committee meeting tomorrow. We are experimenting on many of our children already. We are finding out more information as time goes on, and it's not good. What are we going to find out 6 to 8 months after our youngest kids are experimented on? Thousands of parents are already pulling their children from schools one way or another. I realize that most of the voters in Santa Clara County are in favor of the shots, but as I see it, they are not getting true informed consent right now. And even if they are in favor, it's your duty as elected representatives to be the watchdogs, to protect the citizens. What I'm seeing right now is blind support and trust in our Santa Clara County Public Health Department and Dr. Sarah Cody specifically. They have not earned that trust. We over and misreported just the obvious errors in the deaths in Santa Clara County. We were not aligned with the state per their guidelines about how to fill out a death certificate for over a year.
The next speaker is Andre Oliveira. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Go ahead, Andre.
Andre, are you there? Your microphone is on.
Can you hear me?
Yes, go ahead.
Hi, everyone. I'm Andre Oliveira, janitor and chief steward of SEIU 521 at O'Connor Hospital. This comment goes to all of those who have an agenda that clearly does not prioritize the community that you serve or the ones that serve it. To deny hero pay is a slap in the face for all of those who have been working tirelessly for over a year, putting their health at risk so everyone else can continue with their lives. Full-time, part-time, extra help. COVID does not care which code we are on. We all have been sharing the trenches on this battle against COVID. We are all heroes. Please treat us like it. Thank you so much.
Thank you.
Next speaker is Linda Edwards. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good morning, everyone. My name is Linda Edwards, and I'm a Santa Clara County employee. For the last 19 months, your county workers have been first responders, essential workers, and disaster service workers during this unprecedented pandemic, providing essential services to county residents more than ever before in our history. We worked on the front lines, keeping our communities safe, treating the sick, distributing food, helping people get housing, and providing mental health counseling. We worked in hospitals and vaccination clinics. Many contracted COVID as a result of this work and now have natural immunity. Now we're being told that we have to either get the vaccine or lose our jobs. I urge the Board of Supervisors to instruct Dr. Jeff Smith to accept each and every medical and religious exemption submitted in good faith. Avoid the high cost of numerous lawsuits and negative employee relations, worker shortages, and costly onboarding and training expenses. Let's keep county workers employed and providing essential services for our community. I oppose vaccine mandates and vaccine passports. Thank you. I also want to speak about COVID information that has been provided by the public health director recently regarding the reduction of mask mandates. It seems as if the metrics are very strict, a lot stricter than other counties who have already started to reopen. I was recently in Santa Cruz County over the weekend, and it was very nice to see that people were out and about, relaxed, enjoying themselves, and were doing masks only if they wanted to, but were not required to for indoor restaurants and shopping. I don't know why Santa Clara County is so strict. the metrics are not going to be achievable for months and months to come. By that point, the children will be getting vaccinated, and then it will be lengthened to require them to be fully vaccinated before we will be opening up with mask mandates again. Please reconsider.
Next speaker is Caton Castellino. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good morning. My name is Caitlin Castellino. I've worked for VMC for over 8 years as a speech language pathologist. In May of this year, I had my first child, so I went out on maternity leave in April of 2021. I just went unpaid status as of mid-September. And based on the information sent out by the union, individuals who are on protected leave, including me, are not eligible for the hero pay since we wouldn't be on paid status as of the November 15th pay period. However, I worked in the heat of the pandemic in the ICUs and med-surg floors. I was not able to maintain social distancing with patients as I had to do swallow evaluations and cognitive linguistic evaluations. So I was in very close contact with patients, many of whom had tested negative for COVID when they first came in, but later became positive. So I had seen patients without the adequate PPE as we were not wearing N95s for non-COVID patients. All of us were under significant stress seeing COVID patients and feeling burned out. I had a miscarriage in June of 2020 and then continued working in the ICUs and med-surg floors while pregnant from August 2020 to April 2021. In addition to working on the floors, I wrote policies to keep therapy services staff safe with ever-changing guidelines coming from the CDC and hospital. On behalf of all of the employees who are currently out on protected leave, I would request that employees on protected leave receive the bonus pay. In order to be on protected leave, we had to have worked last year, meaning we worked in the heat of the pandemic. We were fighting for our patients' lives while trying to keep our sanity and stay healthy ourselves during this challenging time. Thank you very much for your consideration and all of the work that you do.
The next speaker is Carlton Allen. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, my name is Carlton Allen. I am a chief steward with SCIU 521. I've been working for this county since 2001 or 2002, I forget. I started working at the county main jail when I first started here and watched the sheriff's department take over and change from correctional officers to correctional deputies. We all know how badly and misran the sheriff's has done. Ms. Smith has been requested to be investigated by this board for things that she has done and her mismanagement of the jails. People are being beaten and harmed and killed under her watch. Now, for somebody in this county to even suggest, while she has not been able to staff her jails, she has not been able to staff her patrol officers, now to turn around and say, let's give her a whole nother department to mishandle and expect that after being voted no confidence, we're going to go and give her another department and give her $10 million more to run a department and take up PSOs who've been doing a great job. We've asked time and time again in our last 2 contracts to staff this department correctly. We have never asked for the sheriffs. We've been told the sheriff's office would never take over. And now the proposal is for the sheriffs to take over. You're doing one thing and saying one thing and doing another by proposing that the sheriff's officers come into our hospital and militarize what has been a disaster. We ask you to stop this right away and come to the table with a better idea than putting our PSOs under her control.
The next speaker is Mont Thompson. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, can you hear me?
Yes.
Okay. My name is Mont Thompson, and I've been worked at Valley Medical Center as a radiation therapist for 11 years. Anyone who wants a vaccine should have access, but due to medical conditions or sincerely held religious beliefs, some healthcare workers cannot be vaccinated. Now, some colleagues and I were granted a religious exemption. However, the county has stated they cannot accommodate us in our current roles. This is absolutely absurd. As a radiation therapist, I've been treating COVID-positive cancer patients throughout this pandemic safely and effectively, even before vaccines existed. I put myself on the line, and I've never tested positive, and our department has never had issues. These healthcare heroes now will not be eligible for pandemic pay, and they will lose their jobs and benefits that feed their families and children. We've treated patients safely who have many types of contagious diseases, some that have no cure, including HIV, hepatitis, tuberculosis, STDs, MRSA, and others. COVID is no different. We wear personal protective equipment or PPE. The county has to accommodate and protect all healthcare workers by providing PPE for contagious diseases. And to say starting November 1st that they cannot reasonably accommodate us and allow us to do our jobs is an outright lie. The California state vaccine requirements allow for religious exemptions protected by the 1964 Civil Rights Act by wearing masks and getting tested. That's reasonable accommodation. That's what we've been doing. What's the difference? No one should be forced to choose between the sincerely held religious beliefs or losing their jobs. We could lose 2/3 of our radiation therapists, and there's a shortage of workers. Allow us to do our jobs or allow paid administrative leave until the constitutionality of vaccine mandates is decided by the courts. Supervisors, please demonstrate sensible leadership. Save our healthcare workers' jobs. Thank you.
Next speaker is B. Beekman. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. My public comment is about the concept of options and how we can be considering options at this time. We may be in that space. It is my understanding the Southwest Airlines pilot walkout last week was for their union to be allowed a better negotiation process and to better consider the concept of choices with a vaccine mandate process. I hope in Santa Clara County we can learn to better address the concepts of education and choices and options this fall, as people are still wary of the vaccine. But to note, it is also being reported about 3 to 5 people a day are dying in Santa Clara County alone. I feel to continue more clear explanations would also help with better choices in taking the vaccines and with community health and safety questions we should all have this fall. From all of this, a reminder, something just got my way here. From all of this, a reminder, COVID-19 cases are on the rise in both the UK and Russia. Continued simple mask use may be able to help much with addressing and limiting the spread of COVID-19 this fall and winter, and especially at holiday time here in California. Thank you for your time, and thank you for allowing 2 minutes to speak today.
Thank you.
I have a few more items to go with 44 seconds. I just wanted to emphasize the importance of mask use, and that I feel that we have to be prepared for the return of COVID, and with that, the return of mask use. And I think the uses of masks can really help a lot this fall, address a lot of issues, and we shouldn't be fearful to use the mask and be flexible and be prepared, I guess, for mask mandates to return if needed, and always be open to ideas. Thank you.
The next speaker is Ray Mark. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good morning, board members. My name is Ray Mark Abel. I'm a material supply specialist at Central Supply Santa Clara Valley Med. We basically fill up all the hospital units with items needed. We appreciate the recognition of 2,500 essential work pay, also known as hero pay. I'm an extra help for well over 2 years now, who work about 60 hours or more per week. As pandemic hits, along with my regular job, I have been involved with a lot of projects regarding handling and distribution of PPE items like gloves, masks, etc. I have helped build up the PPE warehouse at the Oakland Road in San Jose and maintain its inventory as well. Also, help with the command center when needed. The command center is the central supply of the PPE items at Valley Med Center. Just like my coworkers, I went above and beyond my code status and worked tirelessly to serve the community. I am requesting the county to recognize my FTE status. We were running out of hours because of this pandemic situation, and that 2,500 would really help a lot for us. Thank you for your time and consideration in giving labor relations directive in treating workers equal. Thank you.
The next speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good morning, everyone. Scott Largent.
Morning.
Good morning, Mike. I'm on my way to work. Of course, hands free in the truck right now. We had a morning, kind of woke up to another fire out at Spring Street, out at the crash zone, the one that I continually talk about. They're finishing up zone 2 today, which is very, very just shocking that this is happening right now. We have a massive storm that's pretty much heading our direction. We've ripped those fields to dust out there. And it's going to be like, when we used to go to the Cow Palace in the 70s for the monster truck rallies. Most of these people are not going to be able to get their vehicles out of that field. They're not going to be able to get to work. I went through it last year when I was in that zone. My van was 4 feet away from a sidewalk, and I spent like a week digging that thing out. So it's just not the best conditions out there. But now we have probably 400 vehicles in one area. Nobody from the city or county could even think to get some cones out, maybe mark out some areas and just kind of help people organize a little better. I feel like I'm just, speaking to a wall, but this storm's coming right now, and you're going to have all these people that are trying to reestablish camps, reset up shelter. And this is just inhumane. Where's the FEMA tents? Where's the tents from the county? Where's the people? Where's the help? It's just going to be a big mud ring out there of people that can't get to their appointments, can't get help. They're going to pack up our hospitals. We're going to spend all this money when it could be fixed prior. We should have been pulling these people out of their situations months ago, years ago. Fire after fire after fire. It's just very sad. It's very sad, and this is right outside of your county building. You can see this from Jeff Smith's office. Sad.
Next speaker is Ian McGuire. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking. Ian, are you there? I can come back to Ian in 1 minute here. The next speaker. Oh, Ian, are you there?
Yes, I'm here.
Go ahead.
Hi, my name is Ian McGuire. I've been a protective service officer for 4 years, having extensive background in the security police field. I was previously a decorated manager in the English prison service for 24 years, so I've got a management background. Currently, PSOs are valued and considered essential to the safety and well-being of patients, visitors, and staff within this county, and especially at VMC. And regarding these current proposals, there's been no consultation or transparency, and as I'm yet unconvinced of the need to make any changes that will be better for the safety and well-being of VMC employees, patients, and visitors. The current role of the PSOs at VMC works really well if properly resourced and managed, and no logical reason has been given as to why any change is necessary, other than to give the SO or the Sheriff's Office absolute control over security throughout the county, and to provide them with more money to do this. The fact remains that the PSO department has not been properly resourced or managed in the 4 years I've been there. And if you raise this concern, the Sheriff's Office simply blame the county or hospital admin. I would ask that you instruct those who secretly devised these radical changes to begin the process again and involve every affected party, not just PSOs, all the other unions and people who work there, in a more transparent process that seeks to build trust and confidence in any proposed changes. If we start again, ask that you guarantee all views are valued, that no county employee is left behind or disenfranchised, and that our tax burden is not unnecessarily increased simply to provide more power and finance to the Sheriff's Department. We're currently severely understaffed, and we have been for years, and it's becoming ridiculous. I just ask that you look at these changes and make a rational and wise decision. Thank you.
Next speaker is Molly M. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good morning. My name is Molly McLeod, and I wanted to raise again a request that I've made before, having to do with accessibility. Would be really helpful to have the captions turned on right there at the first moment of the meeting instead of a bit of a delay. I'm fortunate to have a really good connection, Maya of Supervisor Chavez's office, and sent an email to her and forwarded it, and this was quickly taken care of, but that's a practice that would really help to have from the get-go. The next thing is anybody joining this meeting would see a countdown, 117, 116, 114, and no information as to where we are. We're in the open general comments, public comments. We've got 2 minutes to speak. And that information could be included so that anybody who's joining and is able to view the actual screen could gather what's going on and then know what's coming up next in the meeting. Another thing that I would find helpful would be a cue of who the speakers are. You know, there are ways to inform somebody you're out of 15 hands raised, you're number 11. With 2 minutes each, that helps on things like going to the bathroom or taking care of a child or answering a door or getting another sip of water, just knowing what's going on. These are small things, but they don't really seem small when they could be done pretty easily and would convey a welcoming message for our democracy. Thanks for your consideration.
That concludes our request to speak.
Yes. Thank you, Colin. Thank you, Molly, for those ideas. I'd ask the clerk's office to please take note of those, and we can discuss that later. Okay, that concludes item number 6, which was public comment. We're now going to move on to item 7, which is the approval of the consent calendar and changes. Colin, if you would please walk us through the update that we have on the consent items.
Sure. We have a request from Supervisor Chavez to present item numbers 64B and 64C during item number 5. Item number 64B is to adopt the commendation for Next Door Solutions to Domestic Violence on its 50th anniversary. Item number
Colin,
6, yes.
Colin, I'm going to interrupt for just a minute. I went ahead and allowed that to happen. So we already did that, 64B and C.
Sure.
I just want to make that publicly, so we won't need to have that on the consent calendar.
All right, I'll move on to the next. We have a request from President Wasserman to consider item numbers 16 and 17 concurrently. Item number 16 is to receive the report relating to expanding the Black Infant Health Program and Perinatal Equity Initiative. Item number 17 is the adoption of salary ordinance number NS-5.22.33 relating to the compensation of employees, adding 1 health education specialist or health education associate position and 1 management analyst or associate management analyst position in the public health department. We have a request from Supervisor Chavez to hold item number 18 to November 16, 2021. Item number 18 is to receive the report relating to next steps for the countywide analysis of schools and post-secondary institutions compliance with Title IX, the Clery Act, and other relevant state and federal laws. We have a request from administration to hold item number 22 to November 2nd, 2021. Item number 22 is to receive the report relating to an air quality grant program for local small businesses and nonprofit organizations. We have a request from administration to hold item number 23 to November 16, 2021. Item number 23 is to receive the report relating to the School of Art and Culture's efforts to undertake affordable housing and community development. We have a request from Supervisor Chavez to remove item number 35 from the consent calendar to be considered with item number 21. Item number 35 is to receive the report relating to a study of the public costs of gun violence. Item number 21 is to receive the report relating to identifying community assets as possible locations to host firearm buyback events, a possible timeline of when events could possibly occur, a budget to host 2 firearm buyback events this fiscal year, and performance matrix and outreach strategies of the Office of the Sheriff Voluntary Firearms Relinquishment Program. We have a request from Supervisor Simidian to remove item number 48 from the consent calendar. Item number 48 is to adopt the resolution delegating authority to the county executive or designee to negotiate, execute, amend, or terminate acceptance of the California Department of Housing and Community Development Home Key Program funds as sole application, an amount not to exceed $33,260,000, and negotiate, execute, and or deliver a state of California standard agreement and any and all other documents required or deemed necessary for the Home Key Program funds. There is a correction to item number 74. The item should read as follows. Item number 74. Adoption of salary ordinance number NS-5.22.35, an ordinance amending Santa Clara County salary ordinance number NS-5.22 relating the compensation of employees, deleting one administrative assistant position and adding 2 clinical nurse 3 or clinical nurse 2 or clinical nurse 1 positions, 1 health services representative position, 1 pharmacist position, and 1 senior health services representative position in the Santa Clara Valley Medical Center. This concludes the list of consent calendar updates. Thank you.
Thank you. And you can take a couple of breaths. And before, Supervisor, before we turn to speakers, I see Vice President Ellenberg's hand up for any changes, additions, subtractions to what we have thus far. Vice President.
Thank you so much. I have a question for Dr. Smith on item 41. I don't think it needs to be removed from consent. Dr. Smith, this is the report from Supervisor Lee on the FGOC meeting proceedings, and I wanted to just ask a follow-up question on the cash position of the county. My understanding is that we have an annual seasonality to our cash balance based on the receipt of property taxes late in the year, and that November is usually a low point. And it sounded like the conversation at FGOC exhibited some concern that the decline in the county's cash position is signaling that we need to, quote, pay ourselves back by allocating the American Rescue Plan funds in the budget. Of course, I expect with all of the federal reimbursement processes that we should be seeing, or we will see, a temporary decline in our cash balance that will eventually resolve itself as those payments come in. Can you just clarify for the board whether you have significant concerns with our cash balance and how it relates to the budgeting process?
Dr. Smith.
Supervisor, we do have cyclical cash balance changes based on the fact that we get revenue on a periodic basis. This year, our cash decline is significantly lower than we would expect, and has to do with our response to COVID. However, you're also right that we do expect federal funding to close that gap to some extent. So we're not at a point where we need to be in crisis mode about our cash balance or significantly concerned. We need to be aware and realize that we don't want to outstrip our capacities. That being said, we will come back to you on the first meeting in November with our staff suggestion about expenditures for ARPA funding. And there will be some recommendations for paying for response to the pandemic that is not covered by FEMA and or other resources. So I hope that answers your question.
It does, and thank you. It brings down the temperature a little bit on what was sounding a little bit closer to crisis. So thank you very much for confirming that. I just want to also make a quick comment on items 49 to 51. I want to thank Consuelo and the Office of Supportive Housing for connecting with my office on 49, 50, and 51. Consuelo and her staff notified my team that these items would be presented today, and I was able to share that information in advance with D4 residents. I also want to thank the Affirmed Housing Group and Danco communities for holding community engagement meetings for the neighboring communities. These meetings and the notifications are really appreciated by myself and by D4 residents, because they allow for a transparent and meaningful engagement process for the communities. And I expect that we'll continue to work at this location and the other developments across my district. Again, gratitude to Consuelo and her team for the quick work with resources for community development on the Home Key application. These Home Key funds present a unique opportunity for our county, so I hope that the application is successful. Again, I appreciate all of the community engagement efforts and look forward to continued work on the site. Thanks so much.
Thank you, Vice President. And with no other hands raised, Colin, let's go to our speaker that we have, please.
All right, our next speaker is Jennifer. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Can you hear me?
Yes, go right ahead.
Thank you, Honorable Board of Supervisors. I'm here representing a large group of Mountain View and Sunnyvale residents who feel that proper public engagement has not been conducted regarding the Crestview Hotel project. Agenda item 48 involves the pursuit of state home key funds for that project, for the Crestview Hotel project.
Jennifer, I'm going to interrupt you for a minute. Colin, if you'll stop her timer, please. Jennifer, item 48, which you're speaking about, has been pulled by Supervisor Simidian to be heard today. It is not being addressed on consent.
Excellent. Okay, thank you very much. I appreciate it.
You
I
got
just to make sure, I had heard that Supervisor Simidian had removed it, so I just wanted to make sure that everyone was aware that the community supports that as well. Thank you so much.
Thank you. Next speaker.
Our next speaker is B. Beekman. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. I think, yes, here it is, item 45 today. You'll be doing your annual surveillance reports and compliance with the Surveillance and Technology Ordinance. Thank you as always for this work. I think this, what it can do for our future is really important and meaningful and helpful. There'll be a lot of camera items this year, and then I know Supervisor Simidian, he's been working on, say, closed circuit television, policy issues for a number of years now. And just a thank you for these efforts. I think we really have to be considering the concepts of biometric camera use. And we have to start to learn a language, how to be more open about it, about its use and what its practices will be. How do we develop open public policies to describe what biometric cameras will be doing? How can we develop ideas of trust and comfort, that this can be subject matter that can be a public discussion? The VTA is currently going through a biometric camera program with its automatic vehicles. They're having a bit of a difficult time to describe what its capabilities are with the public. They've given some early good ideas in an August 19th committee meeting of theirs called the CMPP that I suggest everyone look into in how to talk about these issues better. But from there, they've closed up and they've grown scared and uncomfortable to better talk about it with the community. How do we learn to have that conversation openly? And I hope we really can make the efforts to do that. So it's vitally important what the future of the Surveillance and Technology Ordinance can help with in all parts of our community. And it's the way that we talk to each other in our future and offer good practices. Thank you.
And that concludes our request to speak.
Thank you, Colin. And before we look for a vote, Supervisor Chavez, your hand is raised.
Thank you. I would make a motion to receive or to move the consent calendar. I wanted to make one comment to that motion.
Thank you. I need a second, please. I'll be happy to second that. Supervisor Chavez, go ahead.
Thank you. On item 28, this is a recognition of funds from the VMC Foundation. And I wanted to let my colleagues know that funding was provided for the Vaxmobile in March of 2021 through a consortium that Bloom Energy and Carl Guardino led. And in less than 3 months, the vehicle was designed, fabricated, and our VMC staff flew to LA to bring it back to us. And I know a number of you have done community events and you've had the Vaxmobile out there, but it's just been really impressive how much that's helped us address COVID-19. And I wanted to say thank you both to the VMC Foundation, but to Bloom Energy and Carl and all the other corporations that have been contributing to the VMC Foundation. Thanks.
Thank you. We have a motion and a second. Supervisor Simidian.
Thank you, Mr. Chair. I just wanted to indicate on item number 45, this is our receipt of the annual surveillance reports. And I wanted to ask the maker and the seconder of the motion to incorporate as well a direction to our privacy office to include a separate report. I'll call it an overview report when these items come back in January of 2022, identifying any issues of concern. I guess I would say including but not limited to technologies whose scope of use does not appear to justify the costs associated with the technology, or technologies about which there are specific policy or practical considerations that have arisen in the prior year. I'm thinking of facial recognition as one example, or technologies that in the best judgment of the Office of Privacy generate significant issues relating to fairness or equity or just simple practicality in the near future. So if I could ask for that direction to be incorporated with item 45 on the consent calendar, I will be good to go, sir. Thank you.
Thank you. Motion maker, you okay with that? You're muted, Supervisor.
Yes.
Thank you.
Thank you, colleagues.
As the seconder, so am I. Seeing no other hands raised, call and roll call vote, please.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Semidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Aye.
Thank you.
Thank you, Colin. We now move on to item 8, which is a public hearing with a time certain no sooner than 10 o'clock. It is 10:40. I'm going to open the public hearing and receive testimony. Colin, I don't see any people wishing to express. Oops,
There is one speaker currently.
Okay, let's let that one speaker speak on this item.
The next speaker is B. Beekman. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
All right, this is about item 8, the solar procurement and storage ideas.
Yes, it is.
Yeah, boy, to have conversations about, technology policies, between our community, I think it can just do amazing things with the COVID issues, the vaccine issues, and with this issue of the future of solar and its storage. There has to be an important push to be considering local procurement ideas in solar and storage at this time. I feel if we do that and we consider the ideas of renewables, the importance of renewables at this time, we make really good efforts towards that. We may be facing, some serious natural disaster issues in the Bay Area in the next few years and in the next decade. By doing these things now, it can help us transition to our more regular good practices of these sort of issues after a natural disaster event. We will have in place good local procurement and solar storage ideas ready to go, and good local renewable procurement ready to go more immediately after the time of a natural disaster. I think that's a much more hopeful way to work than just to dump everything into a fossil fuel economy and be satisfied that fossil fuels are taking care of us in the time of natural disaster. I think we have to consider how to work out of a natural disaster time, and that's to be prepared now with our good practices of renewable and storage. Thank you incredibly for what this item can be doing for ourselves at this time and for our future. And you put it first. So I thank you for that. It's an important way we need to be thinking and working. We're doing something awesome here. Thank you. Good luck in all our efforts and how we consider renewables at this time and not fossil fuel.
Thank you, Mayor.
And that concludes our request to speak.
Thank you. We will now close the public hearing, and I'll turn to my fellow board members to see if there's a motion to adopting the resolution making the findings as requested in item 8A and 8B. Supervisor Lee.
Yes, I'll move to move forward according to staff recommendation. I have some comments, if I've got a second.
Second.
Second by Supervisor Chavez. Go ahead, Supervisor Lee. You want to make some comments?
Thank you, President Wasserman. Along with the passage last meeting, thanks to all my colleagues to approve the potential creation of the county's sustainability commission. I really want to applaud the staff's excellent work on this exciting project. With the IPCC UN report coming out recently on the urgency on climate change, it is more important that we continue to prioritize these types of projects, not only for the environment. Here we're talking about saving $2 million a year, and also for emergency preparedness during the most crucial moment. The inclusion of the 4 energy projects that provide a total storage capacity of over 5 megawatts, in addition to generating 12 megawatts of electricity, will also be a huge step to allow infrastructure to continue to function when the power is not available during an emergency. During the power rolling shutoff that we are seeing so often these days in the summer and fire season, or the next earthquake, the storage capacity is what is able to keep our system with the solar power to be operating during the day. I myself am fortunate enough to have put that in my own house with having the solar power, not just the solar panels, but also the power walls, the batteries. And that allows me to know that during the day, if something goes off and I don't have the power, this will allow the solar panels to still operate, because just having solar panels will not allow those to operate. And that's something I learned a couple of years ago. And I think this is really the vision that we really need for a lot of our future solar projects, to have some type of storage in place to make that work. And again, I want to applaud staff's work on this, encourage them to pursue additional projects, especially with the generation of power and storage projects. And I look forward to talking to Dr. Smith that might actually someday happen on 70 West Heading as well, where we park our cars, so that we'll get those panels up there and the batteries. It's more challenging, as he told me, but I do look forward to getting those installed eventually. Thank you very much.
Thank you. And yeah, we have plans to do a new 70 West Heading, so God knows what will happen first. Do we have another speaker? I don't see one. Jeff, thank you for being here. And Jeff, thank you for having Santa Clara County as one of the top alternative energy producing counties in all of the United States. We are so far out there, and when you remove those retail spots ahead of us, we are right up there. It's absolutely fabulous. I'm so proud of Santa Clara County for so many reasons, and this is one of the largest. Thank you, Jeff. Okay, go right ahead, Jeff.
I just started to say, we couldn't do it without the board's leadership and support, Supervisor. This has been a very supportive board in making us the energy saving, energy generation team that we are.
Thank you. And that goes to my predecessors. I got here and you were already on track. You were ahead of everybody else. And let's stay that way, Mr. Draper. All right, everybody. We've got a motion and a second. Call in a roll call vote, please.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simonian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you. We're now moving on to items 9 and 10, which we agreed to hear together. Let me just flip my binder over for a minute. Sorry about that. I see we have Key kicking us off. I assume Key is right there. There you are.
Yes,
I didn't recognize you in that plaid pattern there. Very stylish for October. All right, go ahead.
Thank you. Good morning, President Wasserman, members of the board, Key Lee, Deputy County Executive. I'll provide a brief report on item 9. The report summarizes the process and timeline that we will undergo in order to fully establish the Office of Disability Affairs and an appropriate advisory commission. The administration believes that we can bring forth the implementing actions for the board's consideration as part of the mid-year budget process, which is around the middle of February 2022. The implementing actions will include things such as salary ordinance for positions and ordinance related to advisory commission. Leading up to that date, we will procure and contract with an organization that has expertise in soliciting the feedback of a broad group of community stakeholders, considering sort of the range of abilities, mental health abilities, physical abilities, as well as intellectual and developmental abilities. Of course, we'll also want to consider sort of how those intersect with race, gender, identity, and other factors. Some areas for input include the role and makeup of the commission and objectives for the various priority and policy areas, 7 of which are identified in your report. and the report also provides some information requested by the board as it relates to the all-inclusive playground and our development of affordable housing for persons with intellectual and/or developmental disabilities. With that, happy to answer any questions from the board. Thank you.
Thank you. Board members, we're hearing 9 and 10 together. Key's just gave a report on item 9, which requires no action. We're also going to deal with item 10, Supervisor Chavez leading that discussion. And any speakers, when you speak, it'll be your time for both 9 and 10 together. Supervisor Chavez, you had a question of Key on this item?
Yes, I mean, not a question so much as I'd like to offer some direction to how this moves forward. And I particularly wanted to acknowledge and thank the members of the disability community and advocates for helping the county move this forward. And as part of this, I'd like to add to a motion that the staff, that we're working really expeditiously to proceed with contracting with an outside expert. And additionally, I'd like to request that the staff reach out to the following organizations to let them know about upcoming procurement processes to conduct stakeholder engagement with the disability community and provide anti-ableism training to county staff. The San Francisco State University's Longmore Institute on Disability, the World Institute on Disability, Levant Consulting, Ramp Up Your Voice, and National Council on Independent Living. Colleagues, these are all disability culture consulting firms and organizations with experience that I believe we need to engage for stakeholder engagement. And the staff is also encouraged to do additional market research to reach out to other partners as well. Second, I'd like to request that staff agendize a report at a board meeting as soon as the consultant contract is in place to include the stakeholder engagement plan and timeline.
Thank you. That's a motion.
I'm happy to second that. I have a few additional comments, but I'm happy to wait for my turn.
So a second by Vice President Ellenberg. Should I turn now to Supervisor Smidian, or did you have more to say, Supervisor Chavez? Thank you. Supervisor Smidian.
Thank you, Mr. Chair. I wonder if I could go back to Keely and ask.
Yes.
There was a brief passing mention of our county commitment to affordable housing for folks in the IDD community. Could you run that by me one more time, please? Because I think I might like to ask that we revisit that issue at our mid-year budget, and it wasn't entirely clear to me what the comment you referenced was going to lead to.
Mr. Lee.
Thank you, Supervisor Simidian, for the question. I think as a part of the original referral, the board had requested sort of information on the status of our commitment towards the development of affordable housing for persons with IDD. As the board and members of the public may recall, we've been directed to allocate $40 million towards affordable housing for that community. Thus far, we've been able to allocate $30 million. And as the report indicates, through various actions, the county has committed $14 million towards, I believe it's 4 projects, totaling 329 units, 89 of which are specifically for persons with IDD. Okay.
Thank you. What prompts my question, and I'll ask the maker and the seconder to incorporate an additional direction if they are willing. What prompts my question is precisely because we are in year 3 of what was essentially a 4-year effort at $10 million a year over 4 years to produce that $40 million number. That at the risk of stating the obvious means that next fiscal year could conceivably be considered the last year of a 4-year commitment. I would like us to be in this effort over a longer haul. I wonder if we could ask the maker and the seconder to incorporate a direction to staff when you come back with the mid-year budget report in mid-February of 2022 to comment on the feasibility of extending that commitment over some greater number of years beyond the 4 years that was originally agreed to by our board. And if that's agreeable to the maker and the seconder, I would appreciate it.
Supervisor Chavez.
Yeah, I think that's fine. And what I would also say is that I think as part of mid-year, in addition to the IDD community, I think we have a number of other programs like Veterans All the Way Home and the work we're doing right now to get families housed that are, homeless families. I think it would be worth taking a look at all of those specific areas of need to have that conversation collectively, because I think Supervisor submitting your point is well taken, that we're kind of mid-project for a lot of different communities, and I think it's worth having a conversation about them together. So I think that's a great idea. Thank you.
Thank you. Vice President Ellenberg, you're okay with that as well? Thank you, Supervisor Submitting. Did that conclude your comments at this time?
Let me say thank you both. The only further request I would make is, so that staff is not surprised, is that since we are talking about on items 9 and 10, very specifically an Office of Disability Affairs and a pledge around disability inclusion equity, that this item of our continuing commitment for funding on housing not get simply tossed into a longer list. I take Supervisor Chavez's point that there are other issues we're going to need to look at around our housing commitment, but I want this one to be called out quite specifically and not just an oh, by the way, in a longer list. So I'll let my advocacy go with that. Say thank you again to Supervisor Chavez and Supervisor Ellenberg.
Thank you. With that, I go to Vice President Ellenberg.
Thank you very much. I really appreciate the extensive community outreach that's been conducted by staff, and I am in strong support of this updated plan for a shorter timeline and a contractor, and just really generally looking forward to seeing this new office take a leadership role in the community and truly engage in an interactive way with stakeholders. My office, and I know our board, have heard a specific request made numerous times from the community that we enable captions as the default for all public-facing county meetings, including the Board of Supervisors meetings, the 5 policy committee meetings, and any other Brown-acted meetings that we are producing on Zoom. And I'd like to incorporate that into the motion, if that's agreeable to the maker of the motion.
Supervisor Chavez.
Yes.
Thanks. And on item 10, I just want to express my strong, unequivocal support for the referral and for the inclusion of disabilities in our equity framework. Thanks.
Thank you. Supervisor Lee, you have your hand raised.
Yes, thank you, President Wasserman. First of all, I want to say great job on staff on coming back on this report. I know we've held it a few times, and I do believe this is definitely a improved outcome at the end. and the need is very clear why we need to establish the Office of Disability Affairs. So thanks so much for the extensive outreach for the stakeholders. I really appreciate that. I do want to make sure that the work of this office would complement and not duplicate efforts with the Commission of Equal Access and Employment Opportunity. So I just maybe have staff to explain a little bit of the nuance of the differences. Thank you.
Mr. Lee.
Thank you, Supervisor Lee, for the question. I see Dr. Smith is unmuted, so maybe I'll defer to you, Dr. Smith.
Dr. Smith.
Supervisor, it would be best for us to respond to you off agenda with the charters of both commissions as we're envisioning them.
Yeah, that would be fine. Thank you very much, Dr. Smith.
Thank you. Okay, members, we have a motion on the floor and a second. I wanted to handle 9 and 10 together. I'm going to turn to the public now. Colin, if you'll give each of them 2 minutes to speak.
Supervisor Wasserman?
Yes.
Just so that we're clear on item 10, since some people commented on that, there's some comments I want to make on item 10.
Oh, absolutely. We don't have a motion yet for 10. So
And then we can take them together because I can then wrap up 9 and 10 together in one action.
that is my intent after the
Okay.
public speakers. Exactly.
Do you want me to make those comments now or would you like me to wait?
Why don't you make your comments now?
Okay.
That's what.
So on this item, colleagues, this is asking for the attached disability and inclusion pledge to be included in the board resolution regarding the use of principles of equity in policy and budget decisions, which we adopted on August 25th of August 25th. Of last year, and I would like to request that this come back to us at our December 14th meeting instead of November 6th, as stated in the referral. I particularly wanted to thank Michelle Mashburn with the San Jose Peace and Justice Center for her leadership, advocacy, and authoring the Disability Inclusion Pledge, Equity Pledge. This action is aligned with the June 22nd unanimous approval calling of a referral I brought forward, calling for the establishment of the County Office of Disability Affairs, with the action we took on July 21st last year, committing to the Silicon Valley Equity Pledge. It's imperative that we continue to take steps to ensure the rights and concerns of the disability community are included in all county initiatives, and the county programs and policies prioritize those needs. And as called out in the attached pledge, disability must be recognized as a key element in any commitment to social justice, equity, and inclusion. And with that, what I'd like to do is move items 9 and 10 together with the additions and changes that were incorporated by my colleagues.
Thank you. Vice President Ellenberg, are you fine with that?
Absolutely.
You
Thank
are.
you.
Supervisor Lee, your hand is still raised. Did you wish to speak before we?
Yes, I would like to make a brief comment. So first of all, I want to thank Supervisor Chavez for bringing through this important referral forward. It's certainly true that when we talk about the word equity, the needs of the disability community are often overlooked. Our county has made great strides in advancing equity, but we can certainly strive to be more intentional about including the disability community as part of these efforts. As part of the report back on this item, I would like to request that the administration also report back on the progress the county has made in using principles of equity in policy and budget decisions, with particular emphasis on the county's implementation on the Government Alliance on Race and Equity, the GRE framework across the different departments. Thank you.
So,
Supervisor Chavez.
Yeah, Supervisor Lee, what I would recommend is that I don't want to slow them coming back on the December 14th timeframe, but what could I recommend that come through FGOC at the earliest meeting that they're available and prior to mid-year budget?
Yes, definitely. Yeah, we're not there trying to slow anything down. So come back to FGOC.
Yeah, but also I think it's part of the budget framework. So I like the idea a lot. Thank you, Supervisor Lee.
Thank you.
All righty, it seems like we've got a good thing going here. I certainly want to express my appreciation for the individual, especially Supervisor Chavez, bringing up this focus of our attention, and Supervisor Committee and on the housing. I think the direction we're going is a great direction to go and a wonderful addition to all the great things that Santa Clara County does. With that, Colin, if you'll please allow our speakers to speak.
Sure. The next speaker is B. Beekman. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. In reading the items of 9 and 10, just on its surface, it really describes, kind of good ideas that you need to be looking for and working towards how to help the disability community. How can it be a more understandable process to our entire community? I read in the San Jose Spotlight just the other day that small businesses are really being sued heavily by lawyers of the disability advocacy, I guess. I don't know how to describe that better, but people are being sued. Small businesses are being sued a lot, and it's costing them a lot. So thank you for this item. It speaks to kind of a importance that it's time possibly for county and for government, local city governments to really step in and help facilitate a process where we can start to place better access for wheelchair and disability needs in restaurants and such. And for local government to start to make those efforts can really minimize, small businesses being taken to the cleaners, basically. And so it seems like a difficult situation, and I think we can work out of it because disability issues are positive on the whole to work towards our better ideals with. So good luck how we can work on these things, and I guess just thanks. Good luck with this item.
Thank you.
The next speaker is Molly M. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Oh, Molly M has lowered her hand. I'll move on to the next speaker. The next speaker is Beverly Wong. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Go ahead, Beverly.
Thank you. My name is Beverly Wong, and I'm speaking on behalf of Parents Helping Parents in San Jose. PHP is the Family Empowerment Center and Family Resource Center for families whose children are experiencing disabilities in Santa Clara County. And we want to thank the board for approving the referral in June to establish an Office of Disability Affairs, and also express our support for the work plan and timeline laid out in the interim report provided by Deputy County Executive Lee. And we'd like to reiterate what Supervisor Chavez said, in that we request that the procurement process for hiring an external consultant be expedited in order to keep with the provided timeline. And we also ask that the administration continue to work with community stakeholders throughout the process of developing the office. And lastly, we just want to ask the board to approve adoption of the Disability Inclusion Equity Pledge. It's a necessary step that will set the tone, culture, and priorities of the county so that it can truly live up to its values of inclusion and equity for all. Thank you so much.
I'm going to go back to Molly M. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, this is Molly McLeod. I was so excited I pushed the wrong button. Thank you for calling on me again. Much appreciation for this referral, for the process, for hearing how very important it is to have disability-led consultants, and committing, if you all adopt Supervisor Chavez's addition, to specifically reach out to disability-led organizations that she mentioned. Highly in favor of that. I would also ask a personal request. In the beautiful Disability Inclusion Equity Pledge that Michelle drafted, she refers to the book We Move Together. It's a children's book, but it's for everybody. It's written by Kelly Frisch, Anne McGuire, and Eduardo Trejos is the illustrator. It is the most inclusive depiction of the world that we want now and an accessible future. And I would ask that each supervisor buy this book and read it. It also includes language about ableism and autism and specific examples, because let's evoke what's working well. Let's think about the playground that is accessible, about the Art of Disability Culture exhibit that's going on right now in the Palo Alto Art Center. It's beautiful, and it goes to December 11th. You can visit virtually and in person, have audio descriptions by the actual artists. Let's remember the global effort. There's a global effort for Cities for All campaign to make 100 cities inclusive and accessible by 2030. I spoke to Dr. Pineda last week. This is exciting work. We should join it. Thank you so much.
Thank you.
Next speaker is Sandra Asher. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Go ahead, Sandra.
Hi, good morning. My name is Sandra Asher. I'm a board member at Parents Helping Parents, a board member at Community Solutions, and a member of the San Jose Reimagining Public Safety Community Advisory Committee. I'm also a person with a disability and the mother of a disabled child. I strongly support the referrals on up for vote today and the addition of the inclusion policy to the Board of Supervisors. I also wanted to speak in terms of the housing need. Our disabled
children have a dire need for accessible housing and supported housing. The wait times for my colleagues to get their children into appropriate housing is years. And this is just simply unacceptable. We know that housing overall is a great need in our county, and I appreciate the funds currently allocated and want to ask that continues to be a focus. 89 housing units is a great start being designated for the IDD community, but it is just a start. And I would ask that you continue to allocate resources in that area. Thank you.
Our next speaker is Veronica. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Great, thank you. If you can hear me, my name is Veronica Alador, and I'm also a parent of 2 children with disabilities. And I also want to thank you all for supporting this and moving this forward. This is so important, so much importance into our community, especially when the need is there, right? When so many children have been left without a voice. But I also want to encourage you all to look at the accountability side. How can we make those that are serving our children with disabilities accountable? Because we see so many disparities, especially with children of color, especially with parents who unfortunately don't know the language and don't know their rights. So I urge you all to also advocate for that accountability from the different places that are supposed to be serving our children with disabilities. Oftentimes we're left without a voice. Oftentimes we're left without advocacy. And unfortunately, many of those children are already falling through the crack and they fall farther and farther behind. And where do they end up? Filling jails because they didn't get the proper support that they needed. So once again, I want to ask for accountability within all the partnerships that are working together on this. And I want to also thank you again for pushing this forward and hope to see more come through to support our children with disabilities. Thank you.
Thank you.
Our next speaker is Michelle Mashburn. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, everybody. I want to thank everybody for their efforts on these 2 measures. I also want to point out that ableism is still very, very high within the county structures and within all of the thinking processes that most Americans have around disability. Being disabled does not necessarily mean that you have needs different from any other adult in our society. It just means that you have this involved in your life, and it's something that will continue and you live with it, and it's not necessarily a burden. The problem that society does is they place the burden on the individual, much like the lawsuits and things like that tend to do. Is the individual has to advocate for their rights versus society protecting their rights, as should be the case. So these initiatives help forward these actions, and I'm hugely appreciative that everything, all the work that has gone into it. I will again emphasize nothing about us without us, because if people with disabilities are not at the discussions and at making those decisions, then this is going to further recreate an ableistic structure that we're trying to get away from. So thank you to everybody, and thank you to everybody who's been active in these pledges and in this process. And I look forward to getting the office established and equity for people with disabilities throughout the county programs.
Thank you.
Our next speaker is caller 910. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Go ahead, caller.
Hello. Hello. I just wanted to, I appreciate unhoused people being included in this. I think many times there's a huge unhoused population that is disabled, and they really need a lot of their disability issues addressed. I also wanted to point out some things that are related specifically to you guys. The seats in the chambers, you need more seats for disabled folks, and to make sure that the onus isn't placed on us to ask people, hey, are you disabled? Because plenty of times we find staff and media in those seats. Also, the disabled parking, the easiest disabled parking would be the ones off the patio. And those are actually where staff and council or staff and Board of Soups park. But that would be the best parking for disabled folks. That would be the easiest ones. There should be resource fairs where every single agency is in the same spot. And that would be easiest for people so that they're not going all over the place getting things. Also, less pitting of groups against each other. So right now you have people who need disabled housing pitted against people who are unhoused who need housing versus other groups. If there was a way to just make housing that all the groups could be in there instead of pitting, 50 for this group and 50 for that group, that would be great. And also, can Keeley stay disabled? We just want to check. Thanks.
And that concludes our request to speak.
Thank you very much, Colin. We have a motion and a second relating to items 9 and 10. I see no other hands raised. Colin, roll call vote, please.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you. We now move on to item number 11, which is Supervisor Lee. Supervisor, you have 3 referrals here together under your item. And if you've got some words to say, then we can look to the public and then have a vote.
Thank you, President Wasserman. Item 11 is about the recommendations relating to the video arraignment issues involving criminal court cases. The pandemic has certainly presented many challenges for our court systems this past almost 2 years now, including how to safely allowing our individuals in custody to comply with social distancing, avoiding crowding in the courts. And one of the workarounds the court has used throughout the pandemic is the use of the video proceeding for arraignments appearance before the judge. The use of video proceedings has had many benefits, including reducing the amount of staff time to process those in custody and the associated costs of transporting them from the jails to the court, and having those in custody waking up ridiculously early in the morning or the early transport with lots of waiting times to hurry and wait. However, there have also been many challenges and unintended consequences of video arraignments, which maybe prevent some of the clients from the proper due process and access to the counsel. So what I would like to do is really want to present these suggestions and want to really thank our public defender, Molly O'Neill, and their office for bringing these issues to our attention. And we work together to bring this referral forward. I hope you will join me in approving this referral to improve the video arraignment process for those in custody. And I believe our public defender, Molly O'Neill, is also on the line and available for questions.
Yes, she is. Supervisor Lee, do you want to make a motion first that encompasses all 3 referrals?
Correct. Yeah, I'll go ahead and move to approval of these 3 referrals together. Thank you.
Thank you. Vice President Ellenberg, your hand is raised. Did you want to second or make comment before I get a second?
Both. I'd like to second and make some additional comments on the motions.
Thank you. If you'll please go ahead, and then we'll turn to our public defender and then the public, and then we'll make a motion.
Cool. Thank you. Thank you, Supervisor Lee, for introducing these referrals and for sunshining the challenges that people are facing with their court dates. I want to also thank the courts for their flexibility in ensuring that people have as much access as possible during these times. Since the referral seems to necessitate the coordination between multiple departments within the public safety and justice arena, I'm thinking that really fruitful conversation can best arise if the report back from this referral takes place at the Public Safety and Justice Committee meeting. And Supervisor, if you're amenable, I'd like to make that addition to the motion, which is for the report on this item to come back to December's PSJC meeting, and for it to include an analysis of the ways in which the tablets that are used by the public defenders might be deployed to assist in addressing this access issue. Does that work for you?
Supervisor Lee, you're saying yes, thumbs up?
Yes, thumbs up.
Okay.
Great. Thank you so much.
Okay. And Supervisor Chavez, did you want to speak before we hear from Molly O'Neill?
Oh, no, Molly's great, and then I'll go.
All right, Public Defender O'Neill.
Good afternoon, President Wasserman and members of the board. I want to thank Supervisor Lee for hearing our concerns. And I just had a couple comments. I imagine we can speak more about this in December, but we threw this video arraignment process up as a result of the pandemic without much thought or intentionality about how best to do it. And despite that, we have in fact, done some good work. And while I was opposed to video arraignments prior to us starting to do them, it turns out that our clients, many of them would really prefer not to be transported to court, and it's easier on them to remain out of the jail. I also wanted to thank Captain Paget, who has been very generous with his time. We've taken 2 kind of lengthy tours to go see the video setup, kind of put our minds toward how we might do this better. And so the Department of Corrections has been great and willing to work with us. I also have Assistant Public Defender Sarah McCarthy available. She's been doing many of the kind of nuts and bolts processes related to how to improve this, including a meeting with the court last Friday, where the discussion about putting all video arraignments in one department, which would really help with efficiency and technology and time management. They appear to be willing to do that. So I expect we'll have a lot to say in December when we come back around improving the process. And thank you for your time. Happy to answer any other questions, and Sarah's available as well.
Thank you, Dr. Smith.
I just wanted to clarify, the referral says reporting back to the board on December 7th. I understood a substitution. Instead of coming back to the board, we'll go to the PSJC in December. Is that correct?
Let me check with Vice President Ellenberg on that. If she feels the need for it to go to PSJ rather than straight to the board as the approval is written. Vice President Ellenberg.
Yes, that was the requested change that I made, that it come to PSJC, that I understood Supervisor Lee to agree to.
Okay, Dr. Smith, did you have any other thoughts?
Instead of coming to the board.
That's what she's proposed and what has been seconded.
Okay, good.
Correct. So we can have all of the departments have the discussion in real time.
So come back in January, you're saying, to the board, Vice President?
We can say that now, or we can leave it open based on the discussion at PSJC and bring it back to the board when it's ready to be brought back. Does that make, rather than limiting us to January, or at Supervisor Lee's pleasure? If you want a deadline, happy to make it work.
Okay, Supervisor Lee, we'll just cut to the chase here. Your referral said to bring this back to the board on December 7th.
Right.
Vice President Ellenberg came up with a modification to that, which you agreed on. Do you still wish it to go to PSJC and then come to the board?
Yeah, I think that's correct. Yeah, let's go through PSJC first, and if appropriate and ready, I hope to get it back on the board, hopefully by January, if possible. If it needs more time, then obviously I'll let PSJC decide that. Thank you.
Okay, Dr. Smith, your hand is down. Next up was Supervisor Chavez, then Simidian.
Thank you. I wanted to just add a couple of other recommendations. I love the idea of it going to committee where you're going to have the sheriff's office, the district attorney's office, and the like. I also think there would be benefit in making sure that we're talking to both advocates and also the users of the system, the actual defendants. I think the point that you raised, Supervisor Lee, just about the impact on them in terms of how early people have to get up and, just all of that, I think makes a lot of sense. But I would like to make sure we have that conversation. It might be of value after these changes get in place to do a check-in both with public safety and justice, but also with reentry, and mostly because we just have the partners, we have community partners around the table as well. But I'll leave that to you all to figure out as you go through these first 2 processes. The second issue that I'd be really interested in getting addressed is whether or not it's possible to move the arraignment calendar from 1:30 in the afternoon to 8 in the morning. And the reason for that is that so many people get let out of jail late at night or later at night because of the timing of the arraignments. And, you know, we know that's not been good for them from a safety perspective. It's not good, and making sure that folks can get back to their lives in an appropriate time. So if you wouldn't mind adding that question, and I think that change would allow the public defenders earlier access to information and more time to prepare with clients, and also that it, you know, again, with the night releases. So in any case, I'd be interested in learning more about that, if it can be included, if the maker of the motion is comfortable with that.
Supervisor Lee?
Yes, let me ask, actually, Molly, what do you think about that change of times? Would that work in your schedules?
There are a number of moving parts that impact doing arraignments in the morning. We've had discussions with the court about that, and to Supervisor Chavez's point about late releases, the DA's timing on their filing really impacts when the arraignments happen, and the processing of the paperwork, which is something Matt Fisk has addressed. I believe that reentry is really important, because even if you do the arraignments in the morning, they're at this point not getting processed until 5 o'clock in the afternoon, because they physically carry the paperwork over, put it in a basket, and then they don't start to process until the evening. So a couple other things would have to change, but I think it's really worthwhile to include it in the referral so that we can get kind of all of the involved parties involved in the solution.
Okay, great. Yeah, so I'll be happy to include that into the referral under my motion. Thank you.
Thank you. And Supervisor Simitian, before I turn to you, I just want to share a perspective I have on this. When I read the first referral, item A, it says approve referral to administration to work in partnership, the administration to work in partnership with the Superior Court, the Office of the DA, the Office of the Public Defender, and then report to the board. Item B is approve referral to administration to work in partnership with the court, the public defender, the district attorney, and the Office of the Sheriff. I'm getting a little bit concerned that our item before us is approval of referrals to allow the experts, the DA, the public defender, the courts, to come back to us with their recommendations rather than us trying to design from the dais at this time. I want to tell all of you, I mean, I know this is going to pass, there's already 3 votes, but I was in favor of the referral the way it was written. And Supervisor Lee, I thank you for bringing this forward. And in this form where we say DA, public defender, and courts, please work on this issue regarding video arraignments and come back to the board with your recommendation. So Vice President Ellenberg, that's why I was questioning it coming to your committee, our committee, since we're looking for recommendations from the experts and not from us. Supervisor Simitian, you had your hand raised next.
Thank you. First, on this point, Mr. Chair, maybe I'm just an optimist, but I don't see anything inconsistent with comments from colleagues and your view of this as a referral, nor do I see anything inconsistent with sending it through committee. In fact, I appreciate the fact that it's going to go through committee. I frankly think we do not use our committee system as fully as we can and should. And I think there are a lot of moving parts to these 3 different components that Supervisor Lee has brought us. Sending them to and through committee will allow for a lengthier conversation about what the implications are. So I'm glad it's going to go to the committee. Then hopefully by the time it gets to our full board, it will be a more fully vetted, fully processed, fully analyzed product that is closer to what we would all refer to as good to go. So I think all that's good. What I hear my colleagues doing is saying, don't forget this, don't forget that, please look at this and please look at that. And I think that's entirely appropriate, but my hope and expectation is that that is consistent with the direction that Supervisor Lee was asking us to provide, which is it's a referral, but while you're looking at the referral and giving us your comment, please consider these various points of view. So I, of course, having said all that, have one more thing that I want to add. And my one more thing is who's responsible for what costs? And this is a concern that I think deserves to be particularly highlighted, needs to be highlighted, given the conversation we had not too long ago with folks from the courts who shared their funding challenges. I'm looking at, for example, and it's not unique to recommended action B, but when we're talking about approving the audio and video technical quality of the video arraignments at the county courthouse and Elmwood Correctional Complex, raises an obvious question. How much money are we talking about? Who's on the hook for it? And just so the public defender knows, I absolutely get that if you're going to do a video arraignment, you have to have a quality connection in order to make sure that somebody isn't just disadvantaged by the technology. So I'm sympathetic on that one. But again, I want to make sure, and I guess I'll ask the maker and the seconder to incorporate it as a specific area for report back. And I'll ask my colleague Supervisor Ellenberg when it comes through committee to make sure that we have a clear understanding about who's responsible for what in connection with costs. Thank you. That's my request.
Thank you.
Happy to include it, yes.
Thank you. Seconder of the motion, fine with that? Vice President? Yes, also as well.
Yes, I am.
Thank you. Thank you, Supervisor Smitty, for your comments. Supervisor Chavez, your hand is still raised? Did you have additional? Nope, hand is down. Supervisor Smitty, your hand is still raised? Nope. Okay, Colin, if you'll please allow our speaker to make his or her comments.
The next speaker is B. Beekman. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. Thanks for the timing of this item. I mean, it's on the same agenda as your review of technology, surveillance technology and data collection for the fall. So I thank you for that. I guess, it really simply should be noted that there may be a need of to consider as needed the concepts of facial recognition technology and biometric camera technology for this item. To simply mention it and to know that you can talk about this item as needed. It's important to learn how to make this sort of conversation comfortable. And I mean, we're in an era of COVID-19 and its vaccine process, and it just seems important that we learn how to make these sort of conversations about the future of biometric camera technology a more open, understandable conversation. I think that will build trust. It'll build good practices, as community and what we're dealing with and what we're working with and working towards. We can't keep this stuff hidden in secret and only for a select few to understand. I think it's an openness that can make things understood about our future condition. And this is an item that you'll be talking about in the next few months at committee. Thank you that you want to be using possibly the committee process more. And just to be able to address this subject matter of the technology involved, it's important, and I hope we can learn the process, how to learn to make it an easier conversation to have. Thanks a lot.
Great, thank you.
That concludes our request to speak.
Thank you, Colin. If you'll please take a roll call vote.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you. We now move on to item number 12, the referral by Supervisor Smitty. Supervisor Smitty, go right ahead.
Thank you, Mr. Chair and colleagues. Hang on a moment. There we go. Oops, we're on again, off again. There we go. Thank you. I will begin by asking for approval of the recommended action. So I'll make a motion to approve the recommended action, which is simply to refer to the administration direction for a report back to our board on December 14th with options for the creations of a North County West Valley Health Center clinic located in District 5. And I would ask for a second.
I'll second it.
Thank you. Colleagues, I think the memo is pretty straightforward here about the goal. As I mentioned in the referral, we have 3 hospitals, 13 clinics here in Santa Clara County, but none in District 5, which includes all or part of 8 different cities. You know, with 400,000 folks, more or less, as each of our districts contains. I want to underscore a couple of things. The first is that ordinarily on an issue of this import, I wouldn't be asking for a report back in just a couple of months on December 14th. But in this instance, this is a subject that some of you know I've been talking with staff about for the past 8.5 years. So we've had lots of background on this. This is an area where, in fact, staff has been kind enough to consider the possibilities. And so I think they will be ready, willing, and able on the 14th to come back with some possibilities in mind. I also wanted to underscore that the work that I am hoping such a clinic might do would supplement, not supplant, the good work that's already being done by community clinics in my district. I've referenced that a couple times in the report, but wanted to call it out today. I think clearly the number of potential patients and the need is sufficient to justify the presence of a clinic in a district that has none. But I also think it's important to understand that the current state of affairs has impact on the rest of the system. And I'm thinking specifically, Supervisor Lee of and colleagues, the Sunnyvale Clinic that we do have, which is in Supervisor Lee's district, is one that is overburdened, has lengthy wait times for appointments, and has been impacted by the lack of a clinic in the 5th District to serve 5th District residents who then are understandably headed towards the Sunnyvale Clinic outside our district. That means then that everybody at the Sunnyvale District Clinic is struggling to keep pace. I think I'll just stop there, Mr. Chair, and indicate I think this makes good business sense for our health and hospital system. I think staff will confirm that. I think it makes good healthcare sense for folks in the area. I think it relieves a burden on other clinics, and it brings us a step closer to making sure that we really do provide
Oh, you froze.
healthcare for all, which
You're back. We got you. Thank you very much. Let's hear from the 2 speakers first, if you don't mind, Supervisor Chavez. Thank you. Colin, go right ahead.
Sure. The next speaker is B. Beekman. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, with this item, I just wanted to offer a simple reminder that disability practices that can be part of this new clinic and center. I wanted to also offer the importance of trusting the future of subsidies at this time, and that the use of them can be a subject matter to make it easy. We can talk about it easier at this time than in the past as a community, I think, and the subsidy process will probably be needed for the future of the disability issues that this item can help address. Thank you.
Thank you.
Next speaker is Kayla Williams. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Go ahead.
Good morning, President Wasserman and members of the board. I am here today representing Community Health Partnership and our CEO, Dolores Alvarado. We would like to thank Supervisor Simidian and the board for always looking out for our safety net community clinics within our membership and across the county. We are in support of Supervisor Simitian's request to explore options for the creation of a clinic located in District 5. And we respectfully suggest that the community stakeholder process be created to guide this process and include our member clinics in that area, including Ravenswood Family Health Center, Planned Parenthood Marmonte, and Peninsula Healthcare Connection. We also encourage you to consider increasing access to specialty care in District 5 beyond cardiology and pulmonology. Thank you so much for giving me an opportunity to speak today, and we look forward to collaborating with you in the future.
Thank you, Kayla.
And that concludes our request to speak.
Thank you very much. So we've got a motion, we've got a second. I'm certainly in favor as well. I believe I saw Supervisor Chavez's hand go before Supervisor Lee. So Supervisor Chavez?
Thank you. I think this is the right direction, and I really am excited about it. And I think I've heard Supervisor Simitian raise this, about 100 times. So there you go. I really, what's that? There you go.
101. Sorry for the interruption.
Not at all. And I do really appreciate the idea of the stakeholder process, which I'm sure Supervisor Simitian would be open to too, because I think the point that one thing I just wanted to observe is I think the work that's been done in North County to protect services, Supervisor Simitian, that I know you've led, has created a really interesting network of service providers out there who've kind of been clinging to life with each other out there. So I think that makes a lot of sense. One request I would like to make of staff, not distinct from Supervisor Simitian's requests, because this should absolutely come back as quickly as possible. And that is that I know that the staff had been working for some time on the point that Supervisor Simitian raised about where our clinics needed to be in order to support the 3 hospitals. And now that we have these 2 new hospitals, I don't think I have seen an updated planning process for where we think we're going to need expanded clinics, and if we do. And that may have come to Health and Hospital, but I don't think the board has seen that. And I would really be interested in seeing something come back to the board in early spring that is just reflective of that long-term planning process relative to clinics. If the maker and seconder are comfortable with including that request for information.
Happy to incorporate it.
Thank you.
Supervisor Lee? As the seconder, do you approve
Yes,
that?
as well, yes.
Thank you. Supervisor Chavez, were you finished? Thank you. Supervisor Lee, you're up.
Yeah, thank you very much. I certainly want to say that I'm fully in support of the proposal here. It really is the equity of access issues of those who are living in North County, and that's really long overdue. Not only does it help relieve the patient wait time at the VHG Sunnyvale Ferris Clinic, which, as we have seen, has done a great work, but when you can see that the average wait time is of over 34 days, that you could shows that there really is a need, especially for people traveling from Palo Alto all the way to Sunnyvale. You really, thousands of residents do that every year, and I think we really could. So this clinic's clearly long overdue, and so I'm glad that this is finally being put to the vote. And that certainly would complement those important services of our nonprofit partners like Ravenswood, as mentioned earlier. So I just want to urge my colleague to support this. Thank you very much.
Looks like we're heading that direction. Supervisor Simitian, your hand raised. Anything else to say?
Yes, thank you. And I will take yes for an answer, Supervisor Wasserman, but I did want to say thank you to the cities of Palo Alto, Los Altos Hills, and Sunnyvale for their letters of support. I also wanted to assure everyone that the 3rd paragraph from the bottom of the referral specifically calls out the request for some kind of stakeholder engagement, community engagement, including but not limited to Planned Parenthood and Ravenswood/Mayview. So happy to incorporate that more formally in the direction. And the last thing I want to say, just because I want to plant a little seed here with my colleagues as they think about our county, is this. We, candidly, we all know that the 5th Supervisorial District does not have the level of needs some of your districts do, colleagues. And so I think we can take some satisfaction, frankly, in the fact that the board has always said, let's send the resources where the need is. And that's as it should be, in my view. But we have a kind of a vicious cycle going on here in parts of the county that are sometimes perceived as less needy. And that is as follows. It's tough to be a person of modest means in a more prosperous community. You are largely invisible. People say, oh, there's no need there, which means then that there are no services there, which means then that if you're a person of modest means, it's that much tougher to hang on, to get help when you need it, to access the services you need, which means then that people leave those areas because they simply can't stay there, they can't hang on. And the unintended consequence of not providing these services throughout the entire county is that we contribute to the forced gentrification of some of our communities. We don't have the economic diversity that we would like to have, and that I would argue is not just a matter of sort of good policy, but is essential to the well-being of our economy if we don't have a workforce that can serve these communities. So I am, pursuing this request in part, as I said, just to make sure we get healthcare access to all, in part because I think it makes good business sense for our community, but I also, for our county, but I also think that we've got to keep focused on the fact that if we don't provide these services in certain parts of the county, we can't be surprised that folks can't make their homes there, and that essentially forces them out of the place they would like to call home, and in many cases, the place that they have lived and raised a family over a great many years. Well, so thank you for letting me share that perspective and plant that seed. And I appreciate the support that appears to be coming.
Thank you. Colin, roll call vote, please.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you. Next, we'll go to item 13, receiving a report from our county executive, Dr. Smith. The Honorable Dr. Smith.
Yeah, sorry, got a little distracted here. I wanted to give the board an update on where we were with the vaccine mandate numbers for the county. We have a total of 21,593 active employees that were involved in the mandate. Fully vaccinated, we have 20,181 at this point. These are numbers as of yesterday. That's 93.4% fully vaccinated. Partially vaccinated, another 227. That's another 1.1%. In terms of both pending and approved exemptions, there's 1,018. That's 4.7%. Most of those will be approved. In terms of individuals who failed to respond, and we're still tracking down what's going on, whether they're on leave or simply ignored the warnings, there's 173 individuals. That's 0.8%. So I think we're doing quite well with basically 94.5% either fully or partially vaccinated at this point, and we're proceeding with implementation.
Dr. Smith, I'm going to interrupt for just a minute, and I'm going to challenge any other organization in the nation of 20,000 people or more to exceed our 94.5% vaccinations. Great job. Please continue.
Yeah, I want to thank all of the staff who've been involved. It's involved county council, county executive's office, all of the department heads, almost all of the managers, public health, lots of DSWs, and it's been a huge effort, but it's done very well. So thanks to everyone, and thanks to the board for the leadership. And with that, I'm done unless you have questions.
Thank you for that great news. Seeing no hands, we'll move on to our county council. Mr. Williams, JD. Mr. Williams, I see.
October 18, 2021, closed session by unanimous vote with all members present. The board authorized the county to file or join an amicus brief in Arizona versus Department of Homeland Security, 9th Circuit Court of Appeals case number 21-16118, supporting the Department of Homeland Security's discretion to deprioritize the deportation of certain classes of non-citizens and similar cases in support of the Biden administration's efforts to promote immigration policies that benefit immigrants and the communities to which they belong. That concludes my report.
Thank you, Mr. Williams. Mr. Smith, Supervisor Smidian.
Thank you. I just wanted to ask before we go past Mr. Williams' report from County Counsel's office, if he could share with us an estimated date for release of the video from the Hogan incident that we had directed County Council to provide at their earliest opportunity. I know that's been in the works, and I just wonder if we can plan on a particular release date at this point.
We are working diligently on the redactions associated with the video, and we believe that we're on track to bring that forward at the November 2nd board meeting.
Thank you very much. Thank you, Mr. Chair.
Thank you very much. Okay, we now move on to item number 15. We're going to have the CEO of the Santa Clara Valley Medical Center, Paul Lorenz, here for any comments he may have and an ability to answer any questions board members may have.
Thank you, President. Thank you, President Wasserman, members of the board, Paul Lorenz. Just a very brief update, and this is around COVID-19, and your staff continue their efforts to reach out to the community, particularly in encampments and other shelters, to ensure that we are offering, and they know that we're offering the COVID vaccine, including the booster, and we are also offering the flu shot to our clients. With that being said, I'm happy to answer any other questions regarding our report.
Thank you. Supervisor Smidian, your hand is up. Perhaps that's from before. We'll come back to Supervisor Smidian. We'll turn to Supervisor Chavez, then Lee, and then the members of the public. Supervisor Chavez.
Thank you. I was interested in learning a little bit more about the backpack medicine expansion. And if that means that this is an additional, like we've hired more people to be able to provide this service, or yeah, if you could just explain a little bit more.
So we've had the Columbus Park area in San Jose grow in terms of need. So what we were doing is reallocating and rescheduling our staff to ensure that we have more coverage at that location. Obviously, when we entered the COVID situation, we did augment our team. So we do have support for our backpack medicine team as we go out into the community and focus on certain areas.
But so Paul, it's been reorganized or really expanded?
Well, expanded in the sense that we've utilized the COVID-19 staff that we brought on board to assist the staff to focus in the Columbus area. So we have expanded beyond our normal capacity prior to COVID-19, and we continue to do so in that regard.
You know, one thing I would love to better understand is what the actual expansion is. Like we went from X number to Y number. Sure. And also, you know, just more to understand too, the point you raise about being in Columbus Park. I think you're right about it being a really high need area and a very high need situation right now, as Scott Largent keeps reminding us. And so to that end, I'd be very interested in just understanding a little more detail about what kinds of services are being provided there, and if they're ongoing, you know, more like a standing clinic versus, you know, kind of sweeping through. So, you know, as much information as you could give us. And part of the reason, Paul, you know, just to sunshine this for my colleagues, and I'm interested in this, is that I'm very interested in understanding how our mobile response works and what, if any, further expansion it needs to both to be able to support people who are currently homeless, but even as we move people into permanent housing, we're still having a very high utilization of 911, and it's hard to know if that's because of just the level of illness people have because they're so sick after being on the streets for so long, or if that is learning how to use our healthcare system, all of that. And so the information that you'd be providing would help me just better understand the challenges that we're facing.
Absolutely, Supervisor. We'll explain further on what we're doing, how we're doing it, and obviously why we're doing it in these specific areas.
Yeah, that's excellent. Thank you. Thanks very much, Paul.
Thank you. Supervisor Lee.
Yeah, thank you. The report talks about the Saludos Clinic operates from April through November because those are the peak months for the seasonal migrant workers in the farms. On the other months, for those who actually stay around between December through March, are there other places where they could go to?
Supervisor Lee, the answer is yes. So we do have our standing mobile clinics that go out into the community, particularly in the South County. We also do encourage and promote our Gilroy Health Center to encourage others to frequent that location during those outer months, if you will. But we do have a mobile units that do frequent the various areas in the South County.
Okay, so basically you're saying there's the Gilroy Health Centers and you also have mobile clinics. Do you also have like pop-up tents and things like that?
We work with community organizations to at particular events, and Supervisor Wasserman knows that we spend a lot of time in working with a lot of different community organizations to ensure that people understand what services we offer to the homeless individuals in the South County.
Great, thank you. Now, we are now hearing that they might be approving the second shot for the Johnson & Johnson vaccine. If we recall, we talked about, because of the earlier thought of being one and done, a lot of those who were unhoused were given the Johnson & Johnson vaccine. Do we have plans in place so that as soon as the Johnson & Johnson booster is being approved, that we could outreach to them so that they know that they could get the booster shots?
Supervisor Lee, we are in fact preparing for any further availability of boosters from other manufacturers, including Johnson & Johnson. And so we will be actively ensuring that we promote that availability in the community.
Great, thank you very much.
Thank you. And Paul, thank you very, very much for the great job. I'll say you, but your team, all the people that are under you provide day in and day out. It's a constant and unbelievable challenge. I thank you for that. The action is to approve the operational report. We have no public speakers. Supervisors Lee and Chavez, you still have your hands up. Do you wish to say more? I'll be happy to make the motion to approve the report.
Second.
Thank you. Motion by Wasserman, second by Chavez. Seeing no discussion, further discussion, and no public speakers, call a vote, please.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Smidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you very much. Colleagues, we turn to items 16 and 17, which during the consent calendar, we voted on being heard together. We're going to start with Dr. Cody on 16. And 17 is also Dr. Cody. So you've got them both, Dr. Cody. Go right ahead. This is item 16 is to receive a report, and 17 is adoption of the salary ordinance. Dr. Cody, Dr. Smith, does she have somebody else filling in for her, to your knowledge?
I think Beverly White is going to be doing presentation. Beverly?
Yes, good morning.
Good morning, thank you. And we're going to be handling 16 and 17 together. 16 is simply to receive a report, and 17 then will be our adoption of the salary ordinance. Go right ahead, Beverly, if you have any comments.
Okay, I just had a comment. First of all, I want to thank everybody, the Vice President, Ellenberg and our honorable supervisors this morning for support of our Black Infant Health Program and Perinatal Equity Initiative. The idea behind expanding the program for the Perinatal Equity Initiative is to expand the capacity of the Black Infant Health Program. And so I just wanted to thank everyone for your consideration in doing that for us.
Thank you. I appreciate that. We have no public speakers on this. Do I have a motion regarding 16 and 17? Supervisor Ellenberg. Vice President Ellenberg, your hand raised is the motion maker. Do we have a second?
I also would like to make a few comments and have some things to add.
We'll be right back to you. We have your motion. We have a second by Supervisor Chavez. We have no public comment. So your comments, Vice President, and then we'll take a vote.
Thank you so much. You know, the unjust differences in care and birth outcomes for Black families has persisted for generations, and it will certainly take sustained ongoing efforts to eliminate. I do believe that we have the local expertise and capacity, motivated partners, and a renewed focus on health equity, all of which can drive meaningful reductions in maternal mortality, infant mortality, and other poor birth outcomes in the next few years in Santa Clara County. I really appreciate the effort and coordination of our staff with community partners that has gone into the development of this work plan. Despite the clearly many other demands the Public Health Department continues to balance with our ongoing COVID response. The work plan is reflective of the community priorities outlined in my May referral, and I'm really looking forward to seeing progress on the goals. I also just want to express my appreciation of the Hospital Council, local hospitals, health plans, and community clinics in this work, again, even in this very challenging environment for health system leaders. Partnerships across both the public and private health system will really be essential to reaching our goals to serve Black pregnant people across our large county and across socioeconomic levels, where strikingly we see worse outcomes for more highly educated, higher income Black pregnant people. Some great progress has already been made in the last few months since this board approved my May referral. Santa Clara County and 4 neighboring counties have launched the Deliver Birth Justice campaign to raise public awareness of this issue. And just 2 weeks ago, Governor Newsom signed the California Momnibus bill, expanding Medi-Cal supports for pregnant people to reduce disparities and strengthen data collection to strengthen data collection and provider accountability. And this work plan is another key step to keep the momentum going, especially in planning with the hospitals. I'd like to first ask Dr. Smith if you can confirm that recruitment of the health program specialist will be prioritized so that we can begin formal engagement of health system partners in this work.
Yes, we'll move as fast as we can with that.
Thank you very much. And second, I'd like to add to the initial motion that a follow-up report on this work plan with specific emphasis on the mechanisms of hospital, health plan, and community clinic involvement in this effort be presented to the full board no later than April 2022, and that it include reports from VMC and VHP on their efforts and contributions as directed in the original May referral. I hope that that will work for the seconder.
Does that Supervisor Chavez give a nod or a thumbs up?
Absolutely. Thank you.
Thank you so much.
Okay, so we have a motion and a second. And in item 17, there's the introduction, which we have done, the adoption of salary ordinance number NS 5.22.33. Then waiving the reading and preliminarily adopt on October 19th. And then on November 7th, we'll do the final adoption. Is that fine with you, Vice President Ellenberg? Thank you. So we have a motion and a second. Oh, Supervisor Lee, you wanted to make comments before the vote on this?
Yeah, just briefly, President Wasserman, I just want to say, first of all, thanks so much for Supervisor Ellenberg and Chavez for this really important issue. And something I think a lot of people thought would be the case is that we now have equality in our systems, and that a lot of the disparity is really due to simply the wealth and the wealth gap, and the high and middle class folks would generally fare better. And this report that we got back showing, and to me it's shocking to see that Black mothers and Black infants of high and middle income suffered the same number of infant mortality rates, really shows that this so-called perceived equality today, right here, is not really equal at all. And we clearly don't have the equity. And I think it's so vital, important that this action move forward at both states to move really quickly. I certainly want to appreciate the detail being provided in this report on all the 4 categories, along with the objectives, description of the task, and the staff members responsible for these tasks. And I want to say thank you to Dr. Cody and also Public Health Department for clarifying to our staff about the health education specialist, the part-time FTE management analysts being full-time positions funded by multiple sources. These will be taking on very important tasks, and I truly and enthusiastically support this program expansion to improve African ancestry, maternal and infant health outcomes. Thank you.
Sounds like an aye vote forthcoming. All right, no more hands raised. Colin, take it away.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Aye.
Thank you.
Thank you. That passed 16 and 17. 18 was held. We now move on to item number 19. Receiving a report from Supportive Housing. I'm guessing that's Consuelo. There's Consuelo. Consuelo, welcome.
Good afternoon, Board President Wasserman, members of the board, Consuelo Hernandez, Director, Office of Supportive Housing. This is a partial report back related to a board referral from Supervisor Simidian and Lee. This first part articulates the board's request to create a process by which we would accept applications. The idea is that we would return to you on November 16th with a list of resources that are available. And our approach in this is very similar to other processes that we have in our office, where we create a flexible opportunity, an over-the-counter process, if you will, so that we can maximize and leverage the opportunity at hand without very strict deadlines. And the approach that we have taken here is really looking at the home key funds as an opportunity to leverage the maximum amount of funding. And working with our city partners to address the community engagement, to have some sense of ownership of the development projects by cities and a joint effort with the county. There is an attachment that articulates the guidelines. They are not in final form. They are for discussion today. Assuming that there are no significant changes, we could move forward with issuance of a notice of funding availability that would be over the counter. And really trying to work concurrently upon the express urgency that you all expressed at the last meeting. We can definitely slow down the process if there's interest. And I'm happy to take any questions.
Thank you. We're going to turn to Supervisor Simidian, then Supervisor Chavez. And board members, what I'm shooting for and to give staff advance notice is a break at 12:30. We'll come back and handle a couple items after lunch. Supervisor Simidian.
Thank you, Mr. Chair. I will move approval of the recommended action, which is to receive the report and see if there's a second, and then speak to the material. Thank you, Supervisor Lee. And let me just ask Dr. Smith and or Ms. Hernandez, you know, if the goal is to get agreement on guidelines, do you want formal direction today? Do you want issues raised? How can we, I really appreciate the speed with which staff has turned this around. So I want to say thank you for that. I appreciate the fact that you captured our sense of urgency. To that end, I want to try and get as many issues resolved today, Mr. Chair, as we can. So Dr. Smith, Ms. Hernandez, if we've got specific issues, how can we make sure that they get addressed and are not lingering after today's meeting?
I would suggest that the board indicate their concerns. If they're relatively simple, we can address them on the fly. If they're more complicated, we'll have to come back.
Well, then, as part of the motion, thank you, Dr. Smith. As part of the motion, I will also indicate board approval for attachment A to be slightly amended here if Supervisor Lee is amenable, with the elimination of the last bullet. Forgive me, colleagues, on it's on page 3 of the attachment under threshold eligibility proposals. I want to delete the last bullet that talks about long-term uses, just because I think it will impede our ability to move quickly. And also, I think many of the sites that are identified may not be suitable for long-term housing anyway. So I'll move approval if that's amenable with the seconder, Supervisor Lee.
Yes, it is.
And then a question, Ms. Hernandez, is I noticed in, and I want to try and pull Supervisor Lee into some of this if I can, Mr. Chairman, through the chair. I noticed, Ms. Hernandez, in the staff report says the county's funding requires a leveraging ratio of 1 to 10. It doesn't say that in the program guidelines. And frankly, I'm concerned that for this kind of shelter, that may be too high a leverage expectation. Is that part of the guidelines in your expectation? And can we simply come up with a different number if we wish to do so?
Thank you for the question, Supervisor Simitian. The idea behind the leverage is, and we used a baseline of what we know. You know, we do have 3 proposals from different organizations to build this type of service-enriched shelter. And when we averaged a county contribution of 2.5 to 4, the overall construction cost is showing a ratio of 1 to 10. We are open to being flexible. As I mentioned, an over-the-counter process does allow us to say, in this case, we would grant an exception subject to board approval.
Okay.
So we do want to create a sense of leverage so that the providers understand that we want to see them leverage home key dollars. And whatever mechanism we need to provide that. We're open on in terms of the threshold.
Yeah, I guess, you know, what I'm thinking of is smaller projects, Ms. Hernandez, who might, I mean, we indicate that we're looking at projects that are as small as 50, which is not inconsequential, certainly, where, you know, the cost might be 12.5 million as opposed to 25 million, and but a $2.5 million grant might still be called for. And I don't want to preclude flexibility, ability to be nimble in identifying sites by having a leverage. Like if you want to, and part of what troubled me was the use of the word requires. If we're going to use the word requires, I think I'd rather that we say something like 5 to 1, but with a preference for greater leveraging. Is there is that doable?
I would suggest take the word require out and put should consider, or, you know, some permissive language.
Supervisor Simitian, how's that sound?
And leave the 10%.
Sounds vague. And I'm I don't say that critically, but since you asked me, Mr. Wasserman, if somebody wants to wordsmith some language that says, you know, the county's fund, how about the county's funding seeks to maximize leverage to the greatest extent possible and appropriate. That's still vague, but at least it suggests the importance of leveraging, but provides flexibility. A number like 10 to 1 is pretty clearly not flexible. It's 10 to 1.
Yeah, I like your vague better than my vague.
Thank you. All right, thank you. That's and then a question, Ms. Hernandez, looking at page 1 of 4 in the staff report. It says to implement the program in fiscal year 2021-22, the Office of Supportive Housing, so on and so forth. If I just want to make sure that there is no expectation that the program is, quote, limited to this fiscal year. Again, I appreciate your sense of urgency. I want to sort of say thank you for that, thank you for that, thank you for that. But I do want to make sure that if the funds that the board has committed for this effort have not been fully tapped, rather, by the end of the fiscal year, those funds would be carried over and continue to be available for the program. Can I get a definitive yes on that?
Thank you for the question, Supervisor Simidian. It will definitely depend on the source of funds that we bring forth on the 16th. And so we were really trying to be responsive without, placing us in a commitment of funds before we actually know what funds will be used. So I think I will defer the question to Dr. Smith.
Dr. Smith.
I think the intention that staff has is to keep the money available. Depending on the source of funds, we'll have to comply with the regulations, and there's possibility that the board will have to reappropriate funding just like we do normally in the end of the year. But I would say give us until the next meeting to come up with more definitive language on this one.
Thank you, Dr. Smith. This is one of those times I'm going to look to the board chair, Mr. Wasserman, and say I'm hoping I can take no for an answer. So, Dr. Smith, it is not the intention of the administration to have the program end July 1st of 2022.
Correct.
That would be
not our intention.
All right, I'll take no for an answer. Thank you there. I did want to call out that I appreciated the reference on page 3 of the agenda to the fact that the NOFA, the Notice of Funding Availability, will be used as a call for projects with rolling submission deadlines. And Ms. Hernandez, I gather that is designed to ensure that we can get to the first things first, and then get to second things second, and get to third things third with rolling deadlines. So thank you for that. I notice on that same page that it says the county could recapture a portion of the program funds if the recipient ceases to be a nonprofit agency, or if the facility is no longer used for emergency shelter or transitional housing for homeless persons. I assume that the exception there that says, yeah, it's okay if it continues to be used for emergency shelter or transitional housing for homeless persons, would also apply to permanent supportive housing. Yes, that would be one of the places where we would not be looking to recapture.
If I'm understanding your question correctly, Supervisor Simidian, the intent is to ensure that the program continues in a similar way that we require our permanent supportive housing units to have a 55-year minimum set aside for use as permanent supportive housing. It's the same idea with our temporary shelters.
Yeah, thank you. As I listened to myself, I thought, well, that wasn't at all clear, Joe. So forgive me for that. On that second bullet, this may be the easier way to do it on page 3. Right now, it says the county could recapture a portion of the program funds if the recipient ceases to be a nonprofit agency, or if the facility is no longer used for emergency shelter or transitional housing for homeless persons. And I just want to add, or permanent supportive housing. Does that work?
I understand now. Yes, Supervisor.
Thank you. Thank you. I'll take yes for an answer, Mr. Wasserman. Thank you. And thank you for bearing with me on my language clumsiness there as I went through that explanation. I'm curious if you could just share with us a little. There's reference to a 1-year conditional loan commitment. Is that a normal time period for a loan commitment? I'm just not knowledgeable enough about the programs to understand where that number comes from. So just whatever you can share.
It's our standard term for most of our funding that comes out of the Office of Supportive Housing. Whenever it's a forgivable loan, we find that it incentivizes recipients to advance their projects faster.
All right. And Just two other quick issues I want to see if I can get addressed here. First is actually has two parts, so forgive me. The notion here is that in order to be flexible, the funds could be used as part of the quote construction and development costs, or they could be used for up to 2 years of operating expenses. Did I get that right?
That's correct, Supervisor Smidian.
And candidly, I've been approached by folks in this field who say, well, you know, our operating expenses could be variable for year to year. Sometimes the operating expenses the first couple of years are going to be lower because we're not fully ramped up yet. Would it work to say, we want to take the 5-year budgeted expenses and then, you know, divide that by 5 and multiply it by 2 to get 2 years worth of the average expenses over the 5 years? Or how's that 2 years calculated? Forgive me again, I was a little clumsy with my language.
Thank you, Supervisor Simidian. I will share with you that what we've heard from providers is the hardest thing to fund is the ongoing services, which is why we added the flexibility. Originally, it was a challenge grant of $2.5 million, but through our conversations with providers, the real gap is in the services. And what we are doing in our office is analyzing the cost of all shelters across the county per bed per night, and making a distinction between those that are more service enriched versus those that don't provide the same level of service, to provide some consistency across the way we shelter. And through that, we are looking at some assumptions 1 year over the other. If they apply for home key funds, they have the ability to receive up to 3 years of operating budget. So the county's funding would come in at a later period. You know, maybe we capitalize the reserve rather than issuing the funding, you know, 4 years from now. So those are things TBD, because we don't actually have applications to vet, which is why we left the language very, very flexible.
All right, thank you. Well, I very much want to call out, thank you for the flexibility about saying in some cases it may be construction, in other cases it may be service operating expenses. I think that's the kind of flexibility that we need if we're going to move as quickly and as nimbly as we hope to in this case. So thank you for that. I also want to underscore the continued references to a service-enriched shelter, because, you know, I remember when I came on the board and my first worry was about the closure of the then Sunnyvale shelter, which had played an important role as a cold weather shelter, but it was really just a Quonset hut with a cement floor and people could throw their mats down on the ground, and that was about it. And we have come so far in the intervening years in terms of providing what you describe in your term of our service-enriched shelter. So I think in terms of what we do, how we make
Supervisor,
yes.
We're picking up about 2 out of every 3 of your words.
Well, at least you didn't say that was the good news, Mr. Chairman. So
that's just the last 30 seconds. Prior to that,
all right, I will. Thank you. I will lean in then and say thank you for the service-enriched emphasis. I do want to ask that staff keep an open mind about how to calculate those 2 years. I guess that's all I'm really trying to get to with that particular line of questioning. The length of the forgivable loan term, is it the same 15 years whether they use the money for construction or operating expenses as you envision it, Ms. Hernandez?
Typically, it's the operative date is when they open the doors.
And it can be used.
Yeah, I guess what I would ask you to consider and report back to us on is a shorter time length for if the funds are used for operating costs, because I think it's one thing to have a 15-year lien on a piece of property or development if it's construction costs. I think it's a different matter if the funds have been used for operating expenses. Do you understand the distinction I'm making? Sorry, I'm just feeling tongue-tied today. Not brief. tongue tied, so hang in with me. And then an area that we fortunately addressed at a previous meeting, but I want to just reiterate, is the goal in bringing this forward, as Supervisor Lee and I indicated when we brought it forward, was not to supplement, not supplant funding that was already in the works for any projects that were already in the works in our county, that these would be, quote, over and above. Is that still part of how you're functioning? That was the direction of our board at our meeting.
Thank you for the question, Supervisor. We did increase the range from your minimum amount. You all spoke of 2.5 million, and we increased that to 4, which is, generally the amount that we've been seeing would be the county's contribution for operating expenses.
Awesome.
I see. So the notion is that by increasing the amount from 2.5 to 4, it really will be, quote, more even for projects that were somewhere in the pipeline, yes?
Correct, Supervisor Simitian. The exception is the Mountain View Homekey site, because that commitment has previously been made. And so that came through our HAP funding in a different way. And so we don't include that in this.
All right. Thank you very much, Mr. Chair. Thank you very much, colleagues. Thank you very much, Ms. Hernandez. And again, really big thanks for moving along so quickly and for having a timeline going forward that is as ambitious as this one is. Really appreciate it.
Thank you, Supervisor Simitian. I see hands raised by Supervisor Chavez and Lee. We have no public comments. And when this is done, we'll take a vote and break for lunch. Supervisor Chavez.
Thank you. Consuelo and team, thanks for moving. This is great. This is very exciting. And I'll look forward to even more detail when this comes back and you have the funding sources. I recognize you're in an iterative stage right now. When this comes back, one of the areas I'm very interested in getting highlighted is the speed question, because I think that after listening to Supervisor Simitian, one of the things that I'm mindful of is that the intent here was to get these interim housing developments in the ground as fast as possible. So I know that will be a high priority. I guess my question is, and if you don't know the answer to this, if this could come back to us, is when we see that a project is maybe not moving as quickly as possible, how much flexibility do you have to recapture the resource and find a partner that can move more quickly?
That will really depend, Supervisor Chavez, on the source of funds that we use and our commitment. So if the funding is for services, for instance, it will definitely be a lot easier to move the money around. If it's for capital or pre-development, that makes it a little harder to kind of pull the money out if they're not performing. And this is one of the reasons why we're highly recommending a partnership with a local city, because the city can regulate and make changes that we can't. For instance, if there's a delay with the building permit, if there's a delay with engagement or land use, the city has the power to do that in ways that we can't. And so we're trying to mitigate those delays up front, if you will.
I mean, I think being explicit with our options, because I think one other challenge, Consuelo, is that as you do assessments, I want to make sure we don't, that we have experienced partners where we think that's beneficial, and mostly that, again, that has to do with their ability to work with cities and the like. And I really like that the city sponsorship or the city partnership on the front end, because if that's not there, I think locking up money without that commitment, it doesn't make sense at all. On the last point that Supervisor Simitian raised about the long-term uses of the site, I do want us to be mindful that there should be a mechanism without making this a requirement. I understand Supervisor Simitian's concern about the eligibility, but I think the information about whether or not that the site has capacity for long-term development is pretty critical to our being able to look at where we have land, in the 5, 10, 15, 20-year horizon. So I would like that included without it being an eligibility requirement. The other thing I would just raise is that as we think about our own role, if we were building something like this on property we owned, would we be requiring a challenge grant of ourselves? You know, how would we do that? And the reason is I do think we're going to have some public land that we need to consider.
We wouldn't do a challenge grant for ourselves. We would just build it.
Okay. Okay. So, but we wouldn't use this source of funds necessarily, or we may use it.
Well, we may use some of the funding streams to help us build it, but we wouldn't do it by a challenge grant mechanism.
Well, so one thing I would just say is that if we were able to get the private sector to help fund some of it, I hope we try that. But I hear what you're saying, that we have a different, obviously a different role. I do think we should be thinking about philanthropy even with our own projects on the development side, because I am concerned about the costs long-term for us with operations. It's the right thing to do. I'm not quibbling with that. I'm just trying to reflect what Consuelo, what information you've just given us. Then my last point is that when this comes back, it would be very important to understand how, if we're doing joint NOFAs, how those are being, like if we're doing them with the city, for example, or if it's just the county, what the implications are depending on the partnership that we have with the particular agency. The reason that's important to me is both around the speed issue and around the investment from cities, because what I really appreciate about Supervisor Simitian and Lee's proposal is that it both creates an opportunity for philanthropy, but also for cities to be able to participate, which I think is really wonderful. So anyway, those are all my thoughts and questions. This was very well done. Thank you, Consuelo.
Thank you. And it looks like our final hand is Supervisor Lee.
Yes, thank you. I really want to thank Key, Consuelo, and your entire staff at the Office of Supportive Housing for working so quickly to put this together. As I said in the last month, the building out of 16 modular interim housing sites is a very ambitious goal, but housing our own house requires both solutions. Certainly not a silver bullet, and it would take all of us to make this a reality. And that's why we are trying to open up this funding opportunity to providers who have the creativity and proven capability to help get these developed so quickly, and while leveraging the California State Home Key funds and also with working with our local cities. I really appreciate the opportunity to provide feedback to OSH during the draft program guidelines are being developed. And I'm really glad to see that, for example, nonprofits are also being prioritized as applicants along with cities that can leverage the state home key funds. It is these types of partnerships that would help catalyze the development of emergency interim housing that we so desperately need. And I'm also heartened to see that the applicants will have the opportunity to give first priority to unhoused individuals and families in the immediate neighborhood around the proposed facility. The over-the-counter model, or you call it the rolling submission deadlines, will be crucial for getting the money out the door and into the hands of our partners as quickly as possible that could build these units. And I want to, of course, also applaud the city of Mountain View for approving this first project, and for Palo Alto to also voted earlier to approve a similar project. So my question, Consuelo, is on the one that Palo Alto has put together. Is there enough information for you to determine to say, would this be the type of project that could qualify for $2.5 million or more based on our proposal today?
Thank you, Supervisor Lee, for the question. We've been in partnership and in conversations with Assistant City Manager Chantal Gaines and have joined her at various city council meetings to discuss the partnership. So I anticipate that one is further along than a few others.
Right, that would be great. So we don't know the dollar amount yet, but you believe this is probably one of the first ones that will go be qualified for this, assuming this passed today, correct?
Correct. We've been working with Life Moves on understanding their development budget and their operating budget and looking at it very closely to make sure that the services that are proposed are in fact designed for the people that they anticipate to house there.
Great. I've heard that there's some inkling that the Mayor Larry Klein of Sunnyvale is also looking into this project as well. I don't know, have you, has any dialogue started with Sunnyvale as well on this?
According to their staff, we do meet with all of the city staff that administer housing programs every other Wednesday. And last Wednesday, they reported some initial conversations and that they would reach out to our office when they're ready for an actual project.
Great, thank you. And I do want to echo the comment from Supervisor Simidian regarding the ratio. As he mentioned, say a project at 12.5 million, it would make sense for us to contribute 2.5, and then for all the other sources to combine to about 10. So I guess would be 1 to 4 will be the ratio that we're looking at. Not making requirement, as we said earlier, but this is the type of numbers that we're looking at. They will want to encourage moving forward. So I certainly want to urge my colleague to support this. Thank you very, very much.
Thank you. Supervisor Simidian, your hand is still raised. I'm hoping that assuming that was just left up. There we go. Supervisor Lee, your hand. You're there. Okay. Let's go, Colin, for a roll call vote.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Forgive me, Mr. Chair, did we get public comment on this?
There is no public comment, Supervisor.
Thank you. Then I'll be an aye vote.
All right.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you all. That concludes item number 19. Colin, please double check me, but I believe we have 20, then 21, which will also hear 35 along with 21, and then 48, which Supervisor Simidian pulled from consent.
That is what I have as well.
Thank you. It is 12:35, everybody. Let's be back at 1 o'clock. We'll resume with number 20, then 21 and 35 and 48. See you in 25. Thank you.
Recording stopped.
This is an audio test, testing the audio. This is an audio test, testing the audio. Audio test, audio test. Testing the audio. For anyone attempting to listen on the IQM2 feed, please switch over to the YouTube feed as the IQM2 feed is not currently working. A quick message from the host of the meeting. We are experiencing an audio problem on the IQM2 website. However, YouTube is broadcasting normally. So if you are seeing this via closed captioning or having problems, please move over to the YouTube site. The meeting is being broadcast simultaneously on YouTube. Thank you.
Okay, it's 1 o'clock. Colin, are you there?
Recording in progress.
I'm here.
Wonderful. Will you please take a roll call just to prove that we have a quorum?
Sure thing. Supervisor Lee.
Present.
Supervisor Chavez.
Here.
Supervisor Simitian.
Here.
Vice President Ellenberg.
I'm here.
And President Wasserman.
Here
We
has
have a quorum.
Thank you, Colin. We're now going to turn
Recording stopped. Recording in progress.
All righty. We are now going to turn to item 20. And I believe this is James and Jeff. No, it's James and Miguel reporting back. It's a report on the creation of community development corporations to support affordable housing progress. James or Miguel, I see Key. Key, are you talking?
Yes, President
He is going to
Wasserman.
present on this item.
All right.
Yep. Thank you. Good afternoon once again. The first part of the report gives a background on community development corporations, and as related to affordable housing development, the CDCs typically differ from our nonprofit affordable housing corporations in several ways. First, community development corporations are generally focused in a small city or in certain communities within a city, whereas nonprofit affordable housing developers work throughout the county typically. Usually affordable housing development is part of a broader strategy to improve conditions for a community or its residents. For the nonprofit affordable housing developers, it's mainly focused on affordable housing, although there are incidental positive impacts for the community related to non-residential spaces. And then finally, typically projects identified by CDCs are already have significant community buy-in because the CDCs themselves, their governing boards typically are comprised of large numbers or proportions of residents from the community or their representatives. The other parts of the report describe some considerations as it relates to how to support the establishment or further development of organizations to become community development corporations. More specifically, we talk about some of the funding needs and some of the funding opportunities. There are typically two categories. One is, of course, eventually the financing that is necessary for development opportunities, and then two are the sort of funding for operating and organizational needs. Some funding can be used for general operating support, technical assistance, consultant services, and things of that nature. And finally, the report proposes a timeline for implementing a CDC, what we're calling a CDC grant program, using guidelines that the board would consider on December 14th and informed by any direction provided today. With that, I'll happy to answer any questions.
Thank you. Supervisor Chavez, I see your hand raised. I have 4 speakers. Do you want to make a comment first or after the speaker?
Oh, I'm happy to wait till after the speakers.
Thank you very much. Colin, if you'll please allow our speakers to speak.
All right, the next speaker is Victor Vasquez. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon. My name is Victor Vasquez. I'm the core director at Summers Mayfair and also part of the Seats Athletic Collective. We're in support of items 20 and 23. For decades, we've been working with our community to address gentrification and displacement of our families in Mayfair and East San Jose. We have worked with many strategies to keep our families living here, including even working with the city on local preference bills and ballot of different initiatives to address displacement. And we also have worked to build new affordable housing like the Clara Gardens along with our partners at Aruba, University, and many more. We've learned with our community and we'll continue to learn about various ways so that they can have ownership and also voice in the process of land and housing ownership. We deeply believe that community land trusts, community development corporations, cooperative housing models, and a strong tenant organizing strategy are all needed in our county to keep our families and children at home. It's one of the best, these are strategies to prevent displacement and to prevent the creation of more homeless families. We believe that these funds, that the data has shown that our areas or census tracts are deeply impacted along with Gilroy and other census tracts. And in order for us to recover from this pandemic, our county needs to create place-based solutions and work with organizations like ours, the Cesar Puede Collective, to address systematic inequities in this housing crisis and the displacements that we see every day. We hope that funds, not only from the COVID recovery packages, but also moving forward, are directed into these communities so we can create long-term systematic change and investment back into the communities that generate so much for our county. We support the county's efforts with proposed items number 20 and 23. Thank you for your time and consideration.
Thank you.
Our next speaker is Emily Ann Ramos. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Can you hear me?
Yes, go ahead.
Wonderful. Emily Ann Ramos on behalf of Silicon Valley at Home, or SV at Home, and I'm here in support of the board's interest in supporting the development of community development corporations in the east side of San Jose, Gilroy, and other areas that have borne the brunt of systemic inequities in the county. Community-grounded CDCs could provide important pathways to developing and preserving critical affordable housing resources. CDCs offer us an opportunity for significant community participation and responsiveness, and can develop a fuller understanding of the complexity of community needs and a stabilizing role of additional affordable housing. However, unlike other places around the country where there have been organizations with decades-long experience like Massachusetts, Chicago, a number of cities in New Jersey, and more locally to us, San Francisco, Santa Clara County does not have a long history of established CDCs. So we support building out a community-based infrastructure, but as the staff report notes, the capacity building will take time and commitment. We note that the current affordable housing development and community service work expected to be the central focuses of emergent CDCs are being provided by established nonprofit organizations and a public-private infrastructure that is shaped around experience and aggregated capacity. Investing in CDCs should be seen as the beginning of a deeper institutional support and flexibility to bridge the knowledge and experience of existing affordable housing infrastructure to create a pathway for these CDCs in our county. Thank you so much.
Thank you.
Our next speaker is Rebecca Armendariz. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking. Hi, Rebecca, go ahead.
Hi, 1 second. I'm trying to. There we go. Okay. Hi, folks. I'm Rebecca Armendariz, and I'm wearing my Cara's hat today. Cara's is the Community Agency for Resources Advocacy and Service, of which I am a founding board member. Cara serves families in South County, primarily on the east side of Gilroy. We advocate for many strategies to keep our families living here, as too many have been forced to move to the Central Valley, further away from work and their support networks. We provide renters' rights workshops, advocacy at the city, county, and state level for all types of assistance, funding, eviction protections, etc. We've also worked on educating the community about various ways of developing community wealth and housing stability, and how the community can have a voice in providing families with affordable housing. Community land trusts, development corporations, cooperative housing, and tenant organizing are all models we believe will help keep our families here in Santa Clara County. We support the county's efforts with the proposed items number 20 and 23 to help the community address the needs of affordable housing and economic development using a community development corporation model as one way to address long-term inequities. And we urge the county to work with the communities most marginalized who help build the wealth in this county. Thank you.
Thank you.
Our next speaker is Gabriel Hernandez. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Okay.
Go ahead.
Excellent. Gabriel Hernandez, the director with the Si Se Puede Collective. We're 5 organizations, Amigos, Somos Mayfair, Vegelution, Grail Family Services, and the School of Arts. All of our organizations in one way, shape, or form have been working on addressing gentrification and the displacement of our families. As you heard, working on local preference policies, the law for community opportunity to purchase act, Amigos with rental assistance and safe park sites, their Casitas program. So we've been doing a lot around that. This proposal is yet another one, and again gives us another opportunity to be able to do our place-based work. Our organizations have that trust with the communities, and I think it's really hard to try and translate how that all works. But again, that relationship that we build with community enables us to work with the community to address things like the pandemic, things of that sort. Also, I think in developing this, if you use, again, data-driven information based on the census tracts, you're even going to pick up pockets of poverty in other places like Mountain View and other places within the county. And I think that's also important because a lot of our families, whether they're from Mountain View, Gilroy, or East Side San Jose, are struggling in similar ways. And we're going to do our best to work with any of those communities to share the information that we have around developing the CDC. And in fact, one of our agencies, Grail Family Services, is an established CDC. They started out as a CDC originally. And so we're looking forward to working with the county to address both gentrification and displacement. Thank you.
Next speaker is Matt Gustafson. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, everyone. My name is Matt Gustafson. I was born and raised here in Santa Clara County, where I've lived for over 30 years. And currently I live in 95116 zip code with my spouse and my young child. I work with Somos Mayfair, and we're part of the Si Se Puede Collective, as Gabriel was just talking about. We've been working for several years to address gentrification and displacement in our neighborhoods, and the displacement of our families in Mayfair and East San Jose, which is not getting better. And as Victor mentioned previously, we've been working on a lot of strategies like renters' rights, working with the city of San Jose on a local preference policy that would allow our families to have access to newly built affordable housing in the neighborhood, like at Quetzal Gardens or any number of the other developments coming to Alum Rock. And including the whole anti-displacement strategy that the city of San Jose put out not too long ago. Personally at Somos, I've spent a lot of time working with community members and learning alongside residents to understand alternative housing models that could better serve our community, could help build generational wealth and housing stability, and how community members can actually have a voice in providing their families with affordable housing and deciding how land and housing actually gets used in the East Side. And so, like Rebecca mentioned, there's a lot of models that we think could really work. Community land trusts, community development corporations, co-op housing, tenant organizing. These are all things that we're ready to move on, but really just need the capacity building support and the funding to get there. And we think all these things could help keep our families here in Santa Clara County. So we support the county's efforts to, on the proposed items number 20, number 23, to help the community address the needs of affordable housing and economic development using a CDC, Community Development Corporation model, as one way among many to address long-term inequities in the East Side and in Gilroy. And we urge the county to work with the communities that are most marginalized and with the place-based organizations here who have helped build the wealth in this county. Thank you.
Our next speaker is Ravish Kumar Mehta. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much to the Board of Supervisors for the opportunity to speak as a public speaker and as well as consider to accept the comment. I want to specifically mention about the Community Development Corporation. What it stands for is a well-planned, financially viable, and innovative projects to enhance the job creation, business development for individuals with a low income. Also, to consider that how the grants for the Community Development Corporation evolve directly with the low-income individuals and the families through the creation of a sustainable business development and employment opportunities through the community economic development funds to private, nonprofit, CDC, including faith-based organization, where the CD funded projects create and expand the businesses for the individuals with the low income and leverage the funding in the investment in the communities. Now, it is also to note over here that the city of San Jose, city of Milpitas, city of Mountain View, and city of Sunnyvale, they have a CDBG grant program available and providing the fundings to the certain extent where they are helping with the CDBG colony set aside grant, CDBG disaster recovery program, CDBG entitlement program, as well as different insular areas program and stabilization program for the cities to expand in the CDBG program specifically. However, when we talk about the expanding the grant programs as a whole, for the Community Development Corporation, there are quite a few grant programs available directly with the Department of Human and Health Services, where the County of Santa Clara can leverage directly with the Department of Human Health and Human Services and Administration for Children to avail more grants with the water-related infrastructure, small business relief initiatives, CARES fundings, funding guide, project approvals, and get the funding for the low income.
Thank you.
Next speaker is Jackie. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Go ahead, Jackie.
Jackie, are you there?
Hello,
There
can
you
you
go.
hear me?
Yes, go right ahead.
Hi, this is Jackie Rivera with the South Bay Community Land Trust. We're the first community land trust in the South Bay formed to combat displacement and create collectively owned permanent affordable housing. We set out to establish values including community ownership, democratic governance, and centering of low-income people, racial equity, and wealth building. Similar values shared with CDCs. We're very excited, like other folks and partners have shared, about the county's just overall research into and support overall of alternative housing solutions like CDCs, like CLTs, co-ops, et cetera, that have been named. We continue to see rents and sales prices rise and a great deal of displacement taking place in small site properties where there is limited capacity to preserve the existing affordability. We ourselves emerged to fill this small site preservation and low-income home ownership capacity gap. And we are currently also looking into drawing from other CLTs that are in similarly high-priced markets, including Homestead CLT in Seattle, Washington, the Champlain Housing Trust in Burlington, Vermont, and the 5 CLT members of the Los Angeles County CLT Coalition. Preservation and land acquisition strategies are critical elements of anti-displacement policy and do produce equity and ownership opportunities for low and moderate income residents. We are in support of the county's efforts to support the creation of CDCs and item 23, and recommend that the county expand to explore how to support partnerships between CDCs and CLTs to impact displacement at the neighborhood level and overall capacity building for these efforts. Thank you.
Thank you.
That concludes our request to speak.
Thank you. For the speakers, 23 was held. All right, we are back to Supervisor Chavez, then Supervisor Lee for comments and hopefully a motion.
Thank you. I'm going to begin by moving approval of items A and B with the request that the staff come back in mid-November when we're also discussing ARPA, even if they need to come back at a final time in December with funding strategies. And with the request that when this report comes back, there is more detail on the process recommended for CDCs, including mechanism for technical support. And that would be my motion.
Thank you very much. Supervisor Lee, you were seconding that motion. And did you have additional comments to make?
Sure, quick one.
May I finish, if I could?
Oh, please.
Yeah,
Sure.
thank you so much. I did just want to say, I apologize, Supervisor Lee. I wanted to just say to County Council and the administration that I really appreciated the thoroughness of the report, and the attached examples was really helpful to understanding what the opportunities were. And also just to say that, you know, one requests that came up that I do think would also be interesting for us to take a look at is the structure of community land trusts and whether or not that's something else we would like to take a look at in the future. Thank you.
Thank you. Supervisor Lee?
Yeah, thank you. So I echoed Supervisor Chavez accolade to the staff for coming back with a very thorough report on this issue. So back in the early 90s, I actually lived in the San Francisco Tenderloin while attending the UC Hastings Law College, and certainly experienced the housing and the homeless problems where I lived there. While going to law school, I actually took two classes. One is homeless law, and the other one's a class on community economic development law, and really learn about the importance of CDCs, providing the model and access to funds to build affordable housing to low-income neighborhoods that traditional banks are unwilling to make loans. The success stories in Philadelphia, Massachusetts, and New Jersey state and staff report reiterated why CDCs are really a no-brainer. And I'm frankly shocked that this model has not been implemented here for all these years. I want to thank Supervisor Chavez for your leadership on pushing forward this referral, and let's get these CDCs created in the East Side, Gilroy, and any other areas. Thank you.
I'll say I'm muted. There we go. Now I'm unmuted. That's what I'll say. This report demonstrates a good start and support to providing more affordable housing. We all know the need is great, and I support exploring this new approach that leverages community assets with county oversight. Thank you for bringing this forward. And if there's no other hands raised, Supervisor Lee, your hand is still raised? Nope, that's down. I'll take it down and we'll turn to Colin for a vote, please.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Smidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes.
Thank you.
Thank you. We now move on. Our next item is a combo. It's item number 21 plus item 35. We're going to hear these two together. Receiving a report from the Office of the County Executive. And I've got Gary Hersig on my notes, and I see James Gibbons Shapiro, and I see Gary Hersig right there. Gary, why don't you kick us off?
Thank you, President Wasserman and members of the board. Gary Hersig, Deputy County Executive. Along with me today is Under Sheriff Bender and Captain Durer from the Sheriff's Department. And from the DA's office, we have James Gibbons Shapiro and Chris Areola. Before you today is a report back on the timeline as to possibility of hosting a gun buyback program, budget implications as to hosting an event, and possible areas to prioritize in hosting such an event. These prioritizations are based off on a heat map and census tract data. We also received some updated information from the State Department of Justice on gun purchases in Santa Clara County, which I'll turn over to James Gibbons Shapiro to explain. James?
Thanks. Welcome, James.
Sure. I just want I know that there, or I've heard that there's a question about how many guns have been purchased in our county, how many are legally registered in our county. So in this century, so in the last 21 years, there have been approximately 525,000 guns purchased in Santa Clara County. And that is part of a growing trend of purchases of guns. Last year, 2020, had the largest number of guns purchased in California of 1.1 million statewide.
Thanks, James. And with that, Supervisor, we'll take any questions.
Thank you very much. We have no members from the public, and this is simply receiving a report. I see no hands raised. Oh, we do have one hand raised. Supervisor Lee.
Thank you, President Wasserman. So first of all, I want to thank Gary and James for the report coming back to us. And I do have some update as to what we've been able to figure out since then. My office has been in conversation with Sunnyvale and also Milpitas Police Department. And Milpitas, actually, the police chief, Jared Hernandez, chief, has indicated that they are excited to host a gun buyback program sometime in December, possibly December 11th. Separately, I'm also extremely thankful to receive a commitment from District Attorney Jeff Rosen for a $25,000 grant from its assets forfeiture funds to support for this December gun buyback event. And I'm going to ask the request counties to supplement the funding with additional $50,000 to match the DA's funds. And I would like to ask the administration report back at the November 2nd Board of Supervisors meeting with recommendations on the funding source for the $50,000 allocation to support this gun buyback program. In dialogue with the sheriff's office, and I believe in the sheriff Benders here as well, and he could add that they may not currently have the bandwidth to support a buyback event this year, but prefer to continue the year-round voluntary relinquishment program instead. And that's something that certainly has already been taking place. But additionally, there was some discussion that maybe the sheriff's office could use their forfeiture funds to supplement the voluntary relinquishment program to add more incentive for people to turn in their guns that way. And I certainly would like to continue to re-engage the sheriff's office now that we are moving forward with the funding commitments to support these events. And I just want to open up and ask any questions. If the undersheriff might have any additional comments on that, please. And anything I'm mischaracterized, please clarify. Thank you.
Anything from the sheriff's office in response to what Supervisor Lee just said?
We've had extensive conversations with Supervisor Lee's office and have gotten quite a bit of relinquishment, and we think that is the best way to go in this. So absolutely, we agree, and we've had a lot of conversation with Supervisor Lee.
Thank you. Supervisor Lee, anything else, or I'll turn to Supervisor Chavez.
Yeah, so I would basically want to make a motion to proceed with what I just mentioned, moving forward for this motion to ask the administration come back with on November 2nd for the 50K allocation. If I could get a second, I really appreciate it.
Second.
Any further comments, Supervisor Lee?
No, I'm good. Thank you.
Thank you. We have a motion by Supervisor Lee, a second by Supervisor Chavez. I am going to ask on page 1 of my packet, I see the breakdown where the $100,000 comes from. And Supervisor Lee, I'm trying to understand the difference in what your request was than what is on page 1 of our packet, package page 337.
Sure. So what on the first package basically had the estimation about 100,000. As I said earlier, I was very glad to say that the DA's asset forfeiture funds is coming up to 25. Yes. I'm asking administration to come up with another 50. And we are still going to try to reach out to other law enforcement or community partners or maybe charitable sources to come up with another 25. So basically, I'm just asking for the county to come up with 50, and I'll try to use other fundraising methods to find out the other 50 to make this work.
Thank you. And Supervisor Lee, on page 1 in that box, the second and third lines, 25,000 each, talks about administration. And the two total $50,000. Are you suggesting replacing one of those with something else? I'm still missing the point.
Oh, sure. So what I'm asking is for the administration to look at funding the 50K basically to cover the second box and the third box. I've got the first box covered, and I'll separately work on the fourth box myself. Yeah, thank you.
So your motion is what is already in the proposal?
Correct. Yeah, just the second and third box, not for 50K. Correct.
Okay. Thank you very much.
Thank you.
Supervisor Chavez.
I wanted to. I know we also pulled off item 35, so we could hear them together.
Yes.
And this was a report back on a referral I made in October of 2019, requesting the cost of gun. Requesting that we understand better the public cost of gun violence in our community. And at that time, this was in part in response to the Gilroy Garlic shootings and ideas that local jurisdictions had about how to address gun violence. And since that time, we've had multiple tragedies, including the VTA tragedy. We now have I believe the staff now has a consultant on board. What I would like to do as a recommended action is, essentially it says under advisement, you know, so here's what my concern is. One, I know that we have, you know, obviously our public health department has been addressing COVID-19. That all said, this is still a 2-year process just to get the consulting services moving forward, or about 1.5 years. I know that the consulting services have been brought on board. What I'd like to ask as part of this action is that we include county council, in part because the implications of the study could help position what approach we may want to take to address gun violence. So I'd like to include that we receive the report, include county council in responding, and asking county council to respond either in public session or in closed session to better help us understand the implications of the study. And then I just wanted to confirm with staff when the study would be complete.
Thank you. Jerry, James, anybody?
I believe Dr. Cody is on and should have that answer.
Dr. Cody.
Yes, good afternoon, Supervisors. Sarah Cody, Public Health Director and County Health Officer. As you correctly note, Supervisor Chavez, this study has been delayed. Just after our first report back, the pandemic broke. Our revised timeline, which I believe is included in our report back to you, has the study completion in April of 2022.
So thank you. In the document I'm looking at, it does, frankly, I was curious if that was still the case, but also what was a little confusing to me was and perhaps this is something that you could help me understand, is that it has the final report to the Board of Supervisors. And then I'm assuming that their work product here is the methodology that you're also looking to receive. Is that a product that goes directly to you or to the full board? It's listed separately, which is why I'm asking.
Yeah, so first I want to say that much of this work has been spearheaded by Rhonda McClinton Brown. And so I hope I'm going to answer correctly. Rhonda is on a much deserved vacation today. My understanding is that all of the work, the plan is for all of the work to be complete by April 2022, and that's when you'd have a report. And there's 3 components to it. One is very complex data acquisition and data sharing. There's many disparate data sets that come from many different places, and that's been a tremendous amount of work. The other is the analysis. Much of the analysis is being done by Ted Miller from PIRE, but not all, because some of the more sensitive data, because of challenges with data sharing, we're actually doing in-house under his direction, and he will not have the data. And then the third part is the Prevention Institute is going to help put the whole report together to ensure that we have proper framing and context so that it will really make sense. So all of those 3 parts, the data, the analysis, and the framing, go into a report that we anticipate we should be able to complete by April 2022.
So what I would like to do is ask County Council to involve themselves, do an analysis, but don't make the date later. So this has between March and April. I would like it to stay between March and April. And if that could be included in the maker of the motion. Thank you, Dr. Cody. I appreciate the explanation, and I also appreciate Rhonda not being here. I get that.
Supervisor Lee, do you agree with what Supervisor Chavez just said?
Yes, I do.
So you made a motion, she made a second, she made a friendly amendment, you accepted it. So we're good on that. I've got 1 member from the public wishing to speak. I don't see any other hands raised by any participants. Colin, if you'll please recognize our speaker.
The next speaker is Urvish Kumar Mehta. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you very much again to all the Board of Supervisors and as well as the county staff with regards to the item number 21 and item number 35, gun buyback programs as well as the gun violence. That has been the most the most talking topic for the 5 topping polling candidates within the 2020 and 2021. As we know that the voluntary buyback programs allow the gun owners to trade their firearms to government entities, usually the law enforcement, which allows them for the vouchers, for the redeem for the cash and other items of value. The proposition of a reward and carrot program, which allows the buyback program to set the limit for the
Oops, what happened?
Get the incentive of returning the guns. Also, the Senate and House version of federal assault weapon ban of 2019, which also outlaw the semi-automatic assault weapons and magazines for holding more than 10 cartridges as well. So it is very important to identify that, what kind of a buyback programs are out there and what kind of weapons, that allow the buyback programs to prevail within the county of Santa Clara. The key context is that the buyback program is not just being implemented in the United States of America, but it is being implemented in Yemen, Canada, Australia, as well as the UAE. Also, the rate where the US accounts for nearly 46% of all civilian held firearms in the world, which is according to the Small Arms Survey. So it is very important that the program be implemented, and as well as be identified that, what are the rewards, that is being offered, and also with the safety regards, what are the different weapons and the concealed permit.
All righty.
That concludes our request to speak.
Thank you very much. We've got the motion by Lee, the second by Chavez. No further discussion. Colin, if you'll take a roll call vote, please. And thank you to everybody here participating. Appreciate that.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes, as well. Thank you very much. That concludes our regular agenda. We had item number 48 pulled by Supervisor Simidian. So I'm now going to ask anyone who wishes to speak about item 48 to register electronically to help me determine the amount of time for each person. Before I turn to Supervisor Simidian, Supervisor Chavez, I see your hand is still raised. Did you wish to speak?
I'm sorry.
No, that's all right. Supervisor Simidian, why don't you speak first?
Thank you, Mr. Chairman and colleagues. I ask that this item be removed from consent simply because I know it's a matter of great interest to and in the community. I do want to ask Mr. Wasserman that you provide a moment or two and a little bit of flexibility. I suspect a number of the folks who speak on this item may not be regular participants in our meeting and will be working to determine just how they can access the call. I want to verify with staff two things. The first is that there is a community meeting regarding the Crestview site scheduled for October 27th at 6 p.m. if my calendar is correct. And the second thing is that the actual go or no-go decision on acquiring the site will come back to our board on November 2nd. And if I could just ask Ms. Hernandez, who I see is muted, if I have both those dates and actions correct, that would be helpful.
That is correct, Supervisor Simidian.
Thank you. And Mr. Chairman, I'll let it go at that. The reason I wanted to highlight the community hearing is because I wanted folks to know there would be an opportunity to share their thoughts at that community hearing. Again, coming up very quickly here next week on the 27th at 6 o'clock. And I believe Ms. Hernandez and her team will be leading that community hearing. I'll be sitting in just to take stock of what people have to share. And then the actual go, no-go date, as I say, is November 2nd for people who are trying to follow the somewhat complicated and lengthy process here. Thank you. I appreciate the opportunity to hear from folks who have a point of view on this item.
Thank you. And just to give them a little bit more time, would you please repeat the date, time, and location of the community meeting you have coming on this item?
Yes, and again, I'll look to Ms. Hernandez to confirm or correct if need be but there is a Crestview community meeting scheduled for 6 p.m. on Wednesday, October 27th. So that's next Wednesday, a week from tomorrow, at 6 p.m. And again, this is a community meeting to both share information and hear from folks who would like to share their point of view.
And
Okay.
the location is?
Ms. Hernandez?
It is a virtual meeting, President Wasserman. We did work on sending postcards around the property.
Wonderful.
And we'll send out reminders to folks that have signed up to receive emails.
Okay, thank you. And Supervisor Simitian, we've been at a total, we have 4 now. So
great.
Colin, why don't you allow each of them in? If the number balloons after this, we'll cut the time down to 1 minute, but why don't we give each of these people 2 minutes?
All right. Next speaker is Emilian Ramos. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak. The time.
Supervisors and staff. I want to start by thanking you and the city of Mountain View for moving this along. There's been a lot of hard work done out in the community to talk about this exciting opportunity. The Crestview Hotel conversion is a perfect opportunity to continue toward meeting the goals of the community planned in homelessness. 66 new affordable homes to help those who have previously experienced or may be at risk of homelessness is urgently needed, not only in this site, but all of the 9 proposed applications throughout the county and 4 cities for the Project Home Key funding. This funding from the state is a historic commitment, and it's an opportunity that we cannot pass up. We have to move forward more quickly on this and all developments. Thank you for your support, and thank you for your work.
Thank you.
Next speaker is Richard Mellinger. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, Honorable Board of Supervisors. My name is Richard Mellinger. I am here on behalf of Livable Sunnyvale as a resident of Sunnyvale for 10 years. I want to begin by echoing Emilian Ramos's comments. This is an excellent use of a historic funding opportunity. It's an opportunity for collaboration between Mountain View, Sunnyvale, and the county to address a real serious need in our community. You know, we saw with the Fair Oaks Park that homelessness is a problem in Sunnyvale. It is a problem in Mountain View. And I want to thank the county and Supervisor Lee for their support on the Fair Oaks Park, but it really demonstrates the need of projects like this. This project will improve quality of life, not just for our unhoused neighbors, but for all residents. And, you know, I think that this is a really great use of the Project Home Key funds. It's a great opportunity. Everyone needs to be doing their part. Every neighborhood, every city needs to be doing their part. So I encourage you to please vote yes on this proposal. Thank you.
Next speaker is Kelsey Baines. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. My name is Kelsey Baines. I am the Regional Director for YIMBY Action. We advocate for inclusive communities where everyone can thrive. And I want to thank the board for your leadership, and I'll agree with all the other speakers. And I'll just share briefly that I'm a licensed clinical psychologist. I have experience serving folks who are experiencing homelessness in Santa Clara County. And I really want to underscore the urgent need for homes for people experiencing homelessness, particularly in transit-oriented locations in the North County. My experience was working with veterans, most of whom were receiving services at the Palo Alto VA or at the Menlo Park VA. And those locations, unlike the location in San Jose, offer really valuable programs in vocational therapy and work. And I think having access to transit.
The next speaker is Aaron Eckhouse. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, thank you. My name is Aaron Eckhouse. I'm the Regional Policy Manager with California YIMBY, Yes in My Backyard. I'd like to urge you today to support the Project Home Key proposal for the Crestview Hotel. I think we're all well aware of the extent and severity of the housing crisis and homelessness crisis facing Santa Clara County and the whole Bay Area and all of California. That's why Santa Clara County made a historic nearly $1 billion investment with Measure A several years ago. And here with Project Home Key, we have an investment from the state as well into solving this crisis. We know that the solution to homelessness is housing. That's why it's so critically important that we continue to support permanent supportive housing in locations across the county, including resource-rich and transit-rich locations like the Crestview Hotel. So I hope you'll support this. I think Project Home Key is a really exciting opportunity that it would be a mistake for the county to pass up. Thank you.
Next speaker is Christopher Meyer. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. I'm Chris Meyer, a Mountain View resident, and I've lived across from the Crestview Hotel for about 12 years now. The hotel is literally in my backyard. I'm here to speak in support of the Project Home Key proposal to convert the hotel into housing for our unhoused neighbors. Because in these times of hardship, we need to come together as a community to support each other. As we've seen with repeated studies in California and Florida, having supportive housing can only strengthen the community as a whole. It relieves pressure and financial burden on emergency services, and it provides a stable base for people to get back on their feet. This is a strong step towards resolving the crisis faced by those without permanent residence, which has only increased over the last year of hardship for all of us. This is a shot at hope for those who need it, another chance at getting back on their feet. And why would we deny someone that chance? Project Home Key demonstrates that our community stands for bold compassion and pragmatism in supporting each other, and I urge the board to approve it. Thank you for your consideration. I yield back my 3 seconds.
Thank you.
Next speaker is Hong Liang Fei. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Hong Liang, are you there? Please accept the unmute. There you go.
Hello.
Go ahead.
Yeah, so as a resident of Sunnyvale for more than 10 years, I'm glad the government is working hard to resolve the homeless issues. However, I believe until proper facility use and fundamental key questions are addressed by the county with the residents, the county shouldn't go ahead with the purchase. I sample a few key questions from the residents. So first is the facility use. So right now there's no clear answer of how to use the facility. So what's the percentage for families with children? What's the families without children for the individuals? So do you allow any drug addicts or criminals released from prison to live in? And another is the management. So below are some facts, not twisted, but they are facts. So in the Hillview Court in Milpitas, how could the victim live in without being officially cleared by the county? And in the second street studio in San Jose in 2020 only, there are more than 500 police and medical emergency calls. So, and 4 preventable deaths. So given all these facts, how could we residents believe?
Next speaker is Urvish Kumar Mehta. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you very much. I again wanted to thank all the Board of Supervisors. I wanted to mention about Governor Gavin Newsom's visit on June 25th, 2021. The nation's most populous state has estimated that about 250 people sought housing services from local housing. And also I wanted to make a point about the Project Room Key and Home Key both, where the federal funding is available for the house homelessness residents in hotel and motels. I also wanted to clearly outline the differentiation where the city and county's jurisdiction takes apart when any particular hotel or motel being considered as a site for the Project Room Key and a Home Key. Also, it is very important to ensure that the bill gives $12 billion for the new funding to get more people experiencing the homelessness into the state. So certainly for the Santa Clara County to highlight and taking the action with regards to these projects as to support the expansion of housing for the people experiencing the homelessness. Thank you.
Next speaker is Jennifer. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
I am here representing a large group of Mountain View and Sunnyvale residents who feel the proper public engagement has not been conducted regarding the Crestview Hotel project. And until proper facility use and fundamental key questions are answered, this home key funding should not be pursued. There has not been proper engagement, and there are very valid fundamental questions about this facility. Home key funds come with a 55-year commitment, strict application principles, and none of this has been discussed. When Supervisor Simidian at the last meeting mentioned the difference between notification and engagement, residents have not been engaged. And I have observed this. They have not been engaged. Freight train moving forward without any real public engagement. These need to be addressed prior to seeking funding, prior.
The next speaker is Tina. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hey, can you hear me now?
Yeah, go ahead.
So I'm here representing mostly Asian and especially Asian women. There have been plenty of data showing that the homeless is 10 times as likely to commit crime, and the victim is much more likely to be Asian people, especially Asian women, and there are plenty of news and plenty of data behind that. And I believe most of the homeless people are good, but it takes only a few bad doors to ruin a family. I have two specific questions. First is one, who is responsible for stopping allowing criminals, people with criminal record to live in the site? And two is who is in charge of stopping people with mental illness record to live in the site? And three, actually, is there any enforcement stopping them letting their friends with such record to live in there? And last, do Asian safety matter?
Next speaker is Tony G. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Go ahead, Tony.
Hey, this is Tony Guan from Sunnyvale. I echo Jennifer's concern without proper engagement from both sides of the boundary of the city boundaries. This project should not go ahead apply for the home key funding. I have mainly one question for you to think about: how to ensure that you do what you promised to do. It's a way. Yes, we need to help the homeless population, but how the good intention can go out and make a very bad impact for both homeless population and the local residents. So I would like to ask you to establish a resident oversight committee to oversight this project to ensure it's properly executed. Yeah, without that being promised.
Next speaker is Kevin Ma. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Afternoon, Board of Supervisors. My name is Kevin Ma. I am a Mountain View resident, and like the earlier speakers, I'm in support of this project. Homelessness is not a moral failing. Homelessness is a failure of much of the issues in our society, where we do not have the right amount of jobs that that pay decent income for them, that we have the failure to provide enough affordable housing to be able to give people a safe, stable shelter in the richest counties in the richest state of America. And for the previous comments about criminality, it's not like we even do criminal checks for home buying. Like, most crimes are not committed by the homeless. Homeless people actually, in fact, get a lot of harm on them due to their circumstances. And as a society, we should be propping up people so that they can be able to, live a dignified life. And if it takes money from the state to do so, then we should go for it with all deliberate speed. Thank you.
Next speaker is Emma. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Emma. I'm a resident. Can you hear me?
Yeah. Oh, yes.
Hi, thanks. I'm a resident of Sunnyvale for almost 10 years. I am against this agenda. There are simply too many questions regarding this project, and the vote needs to be delayed. No home key fund should be pursued until our questions are answered, and the county has not properly engaged the residents. We have many concerns regarding this project. We have many questions about this project, and we want to fully engage in this process, not simply be notified. Thank you.
Next speaker is Rob Moore. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Go ahead, Rob.
Yes, yes. Hello, County Board of Supervisors. My name is Rob Moore, and I'm a resident of Santa Clara County and a housing commissioner in Los Gatos. I've worked extensively with people experiencing homelessness, and I think this is an excellent opportunity to make a real impact in the community. We're all keenly aware of the housing shortage and the humanitarian crisis that is homelessness. I too echo the sentiments of earlier speakers. I think we need decisive action to meaningfully address homelessness in Santa Clara County, and I see this as that. I urge you to vote yes on this item. Thank you.
Next speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everyone. Scott Largent. Kind of got on the meeting a little late, so just bear with me. I fully support the project and what's pretty much coming out of the home key funds. You keep hearing the callers talk about this being a crisis, and this is a humanitarian crisis. I did a little more research. I started going on the United Nations website and started looking over what's going on in third world countries. And this is what's developing in Santa Clara County. The conditions are inhumane, and you guys are not getting ahead of what's going on right now. We need FEMA camps right now. We need some action, and we need it fast. It sounds like other cities are getting on board. Example, City of San Jose, they're just pushing their problem into the creek next to your county building, and the people aren't being supplied services, basic water, just basic human rights. It's wrong. Thank you.
Next speaker is Will Shaw. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
I'm also a resident in Santa Clara, and I think the decision of changing the hotel into a home key program might not be appropriate, because I think when we try to help homeless people, we should also consider where they're currently habitating around, and that could be what their preference is, and randomly select some locations that some of the people are not familiar with, and although we provide them accommodation, then not might be what they actually want. So I would think the committee should study this case more and try to find a more appropriate location for those people. Thank you.
Next speaker is Sabrina. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Okay, can you hear me?
Yeah.
Oh, thanks. I represent the Sunnyvale residents. I have been here for more than 5 years. I strongly oppose this agenda, especially the location for the homeless shelter. It's not about the safety issue. I already worry about the homeless. That is like the cost of living in Sunnyvale is quite expensive, and also that doesn't have much service or kind of work that is available for the homeless one. So it's good for the shelter to be some place that is more suitable for the homeless, and also it's kind of protect our kids. Like my son is play every day near like bikes near the area around the hotel. So it's like bring so many populations, and it's potentially will bring some other issues. So I just worry about some safety, but worry about also about the homeless, that is whether they can melt into the society.
Next speaker is Dan. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello. Can you hear me?
Yes.
Okay, cool. So I'm a Sunnyvale resident, and personally, I do understand the importance of the home key project, but I'm afraid I will not agree with this project until some of my concerns are properly addressed. First is, I want to know information about the process, how the sites have been selected, not the others. Second, so we know, I totally believe most people, including homeless, they need help, they are good people, but there are some safety issues on other sites we have heard of. So what's the city's plan on addressing or say preventing any potential safety issues? I do want to know about that. Thanks.
Thank you.
Next speaker is Angela Rausch. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. Timer will start when you begin speaking.
Hi, my name is Angela Rausch, and I've been a resident of the county for 17 years. I'm a board member of Livable Sunnyvale, and I'm a co-president of St. Vincent de Paul Society in Sunnyvale. I'm speaking on behalf of myself. Over 10 years ago, I met my first unhoused person while I was working at the Road to Carefree Clinic. That clinic was sadly closed. This lady came to the clinic for health care, which is common, but she also showered at the local 24-hour fitness, which was her only option. Housing, I believe, is part of healthcare. In my role as co-president of St. Vincent de Paul, we staff an emergency helpline for anyone struggling with rent or food. I'm still seeing a need. Our church ministry is a Band-Aid, a sort of last resort. I'm here requesting you support this. Please check out the great success of Parkview Studios in Sunnyvale. Homelessness can be minimized if we all work and compromise together. Thank you.
Next speaker is Ben S. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, thank you for making this kind of forum for all of us to understand other people's opinion. So for myself, I'm not suggesting to propose for or against, but as a 14-year Sunnyvale resident, right, I understand there is a need to address human basic rights, and I'm all for that. However, from the lack of transparency and detailed plan being communicated to the city residents, especially all the questions mentioned above, right, I do want to make the point that I oppose making a decision at this very moment until a lot more information are properly communicated. And I again stress that I think communication is what can bring all of us together to solve this challenging problem. So if we cannot make a decision right now, I suggest we vote no at this point before we move on.
Next speaker is Alec. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. Timer will start when you begin speaking.
Hi, everyone. My name is Alec. I have been a resident of Sunnyvale since 2 years ago. Although I fully support the homeless shelter or project like this to solve the challenges we may face in the community. However, I do have two concerns. The first concern is from the residents' perspective, and the second one is from the potential homeless residents' perspective. For the first part, I do think this project decision-making is lack of clarity so far. For example, for me, I only heard about this hearing today. I only heard about this today. I wasn't aware of there's gonna be a decision-making process happening right now. So I do think there are a lot of people in our community having the same issues. So before we solve this clarity issue, I think we should vote no. And the second part is how the county is gonna make sure the homeless residents is gonna incorporate into our community and contribute.
Next speaker is Jennifer Hardy. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm Jennifer. So I lived in Mountain View for 10 years on Crestview Drive, directly across the street from the hotel. And now I live just across El Camino in Sunnyvale. I've been there for 3 years. So this is basically in my backyard. I think it's a great idea to turn this into a homeless shelter. The hotel has changed hands 3 times since I've been in the area. It's clearly not profitable. I think this is a great use of the space. And I also think it's a really good area for the homeless. There's a Safeway and easy walking distance, and there's a bus stop right across the street. So I think it makes a lot of sense logistically. I just can't think of a better spot you could put something like this. And I think most of the objections really boil down to people not wanting one at all. I think we should absolutely support this project. I think it's a good spot for it. Thanks.
Next speaker is Zijan Liu. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, can you hear me?
Yes, go ahead.
Oh, thank you very much for letting me talk. So I'm a resident in Sunnyvale. The hotel is quite near to where I live. I do understand the necessary support for the humanitarian help with the homeless people, but I do think at this stage, this project is not mature enough to let it go on. because there are several issues, as many residents have mentioned, we need to address. For example, the safety, the impact, the environment impact, the business environment impact, and also how can we guarantee those people that are not qualified to move in. For example, can we implement some background check policy to make sure those people without a criminal record can be moved in, and then we can help them. So there are a lot of issues we need to address before can let this project going on.
Next speaker is Ashley. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Ashley Zhang. I'm a resident very close to the hotel. I'm here to against this the proposal that to seek the fund before we have a clear and durable plan. So if we want to house the homeless people, I think we have way more less expensive area and more affordable area to look for towards. So again, so I will oppose this proposal to seek the home key fund before fully communicate with the neighborhood. Thank you.
The next speaker is Livable Sunnyvale. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, this is Agnes Veith. I am a longtime Sunnyvale resident and a board member of Livable Sunnyvale. There was a time in my life when I was housing insecure. I remember it being a very terrifying experience, and one I found myself in through no fault of my own. I was doing everything right, but situations in my life changed unexpectedly. Unfortunately, many individuals in our community experience housing insecurity that turns to homelessness while they too are doing everything right. I think all of us need to see the face of the unhoused as members of our community who have fallen on hard times and need kindness, not condemnation. Martin Luther King said, "The time is always right to do what is right." This is the time. Please do what is right. Thank you for considering my comments.
Next speaker is Grace. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Grace. I'm the resident of Santa Clara County. And first, I want to say I against this this bill. And second, I think I fully agree we should help the homeless. However, we need first to answer the question that what is the existing shelter conditions? Are there any, are those already full for all the homeless? Should we do more research and more time and monies on the existing shelters instead of seeking more places? And there's a lot of uncertain things. So, and also I think instead of provide the houses, we also need to spend more money for improve their skills to help them to get out of this homeless situation and help them to find the jobs, and so that they will not become the homeless. Thank you.
Next speaker is Angela Tao. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, can you hear me?
Yes, go ahead.
Hi, I'm just in line with what just Grace said. I'm a Sunnyvale citizen for like 5 years, more than 5 years. I think providing a shelter is not a solution, right? It's kind of a band-aid. We need to think about how to help them to get unhomeless, right? To provide the jobs, training stuff. So, and also I believe this is the taxpayers' money. So do you have any alternative second solution on what is a low-cost region that we can have a complete, well-rounded the program to help them? Because provide one hotel, no matter where, it is okay, but it's not sustainable. You will have a ton of the homeless coming, and what is next? You're gonna convert another one grand hotel into a homeless shelter? So that is my opinion.
The next speaker is Alice. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Oh, hi. Can you hear me?
Yes, go ahead.
Oh, yes. I don't agree with that idea. I'm so sorry, because I live in Sunnyvale for a long time. First of all, I think the traffic is really horrible right now. Why send more people in the city? There has a lot of space, no people in there. Why don't you send them to there? Yes, and another thing is for safety thing. I am an Asian lady, so I'm really care about my safety things and my children's safety things. So there people doesn't have a job. When everybody go to job, they are stay at home working on the street. I'm not sure what kind of things they can do. So sorry, I'm a normal people. I just want to have a great environment living here. So I cannot using the gut review to look at the work.
The next speaker is Xiao Yi. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm a resident of Mountain View and then Sunnyvale for over 7 years. I think this decision-making process is problematic. That I personally got this information from a chat group of concerned citizens, and I'd never got any information otherwise. I think this lack of transparency is alarming to me, and this kind of rushing for a decision can be problematic. I think we need to have more community engagement. And I think, I've been here for a long time, and I know this is the prime location in Sunnyvale and Mountain View. It's one of the most expensive places you can think of in this neighborhood. So I'm puzzled that why the county wants to spend so much money on the hotel for homeless people, while they can be, you can build a lot better or more facilities somewhere else, like in Santa Clara City. There are a lot of, even on El Camino, there's a lot cheaper. So I'm opposed to this project. Thank you.
The next speaker is Eunice. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, I'm a resident of Sunnyvale and a mom of 2 little girls. I don't think a typical resident like me are fully engaged of this project. We don't actually know how the sites got selected. No one asked for our opinion when they want to build something right next to our homes. We don't want just being notified when the county already made a decision. The fundamental questions like safety issues are not being addressed with residents. Until those got addressed, I don't think city or the county should process with this project. And I have questions about how do you ensure people who will live there with criminal records, how do you ensure that will not happen? What are the prevention procedures about those? And the safety issues is like the very big concern for all the people, the people with families, children, and elder people. This should be addressed.
The next speaker is Sean. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, I'm Sean. I live very close to the Christmas Hotel at the Mary Avenue. So that's my backyard. And I think the main thing is the lack of transparency and the fairness in terms of why this location is selected. I hear a lot of people from Mountain View, a lot of Los Altos residents saying they support this location. But look at this location. This is right at the border of Mountain View and Los Altos. And mostly is Sunnyvale resident being affected. So is it someone from Mountain View or Los Altos trying to solve their problem, homeless problem into Sunnyvale resident? I don't think that's really fair. I'm 200% support to solve the homeless problem by providing more housing, but we have to share all the burden all together. We cannot allow the richest people from Mountain View, like their housing price is higher, to solve the problem in the poor communities. Thank you.
The next speaker is Jordan Grimes. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Go ahead, Jordan.
Yes, good afternoon, supervisors and staff. My name is Jordan Grimes. I'm the political director of the Peninsula Young Democrats. Like many of the earlier speakers, I'm here in strong support of utilizing home key funds and moving forward with this as fast as possible. Housing the unhoused, the most vulnerable members of our communities, is a moral imperative, and we should and must use every resource at our disposal to do so. This site is a particularly good location to do that, given its proximity to services and transit. I urge you to prioritize the needs of those who do not have housing, of those who are suffering over the wants and whims and the fear, uncertainty, and doubt being peddled by those who are already comfortably housed. Our housing and homelessness crisis is a public health crisis, and the county should move forward with this as soon as possible. Please do not delay and act now. Thank you.
The next speaker is Cecilia. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, can you hear me?
Yes, go ahead.
Hi, I'm a resident in Santa Clara. I'm here to strongly oppose the home key project because from my point, it sacrifices the neighborhood nearby. Thank you.
The next speaker is Leah. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, can you hear me?
Yes, go ahead.
Hello, everyone. I'm a resident of Sunnyvale, and I've been living in Sunnyvale for more than 5 years. I have a newborn boy, just 2 months old, so I care the security of my neighborhood much more than before. Could not pay more attention to my neighborhood security. So I hope my boy could grow in a secure neighborhood, and as my home is just 10 minutes walk away from the hotel, so I strongly oppose this project. And as previous speakers already mentioned, the county has not properly engaged residents nearby. We want to be fully engaged in this process. I didn't know this project until yesterday, so I don't think I get enough engagement for this project. So until proper facility use and the fundamental key questions are addressed, like how the site is selected and what's the process to select the people who could live in the hotel.
The next speaker is Kathy. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Can you hear me?
Yeah, go ahead.
Oh, this is Cassie. So I'm a resident in Santa Clara County, and I'm represent most of my neighbors and groups in these areas. So what I want to say is we're totally against this proposal, because there are too many issues to be addressed before moving forward. First, this agenda is like try to quietly move forward. I think there are too many things we need to discuss, like safety issue and the location, how the location get chosen, and there should be more population, more effort to be engaged with the resident in these areas. Second, I think Sunnyvale and Santa Clara has relatively higher living costs in Bay areas. City could pay more, in order to support this project. So why don't we choose some cheaper placer with the money we have? And the third, I think provided the shelter is not the fundamental.
Next speaker is Lucy. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Lucy. I'm Sunnyvale resident, and I represent the Asian woman in a nearby location, and I vote for no for this project because I think the location is inappropriate. So the location is not nearby transportation like subway or train station, and not nearby the job market. So if you place those homeless people there, what you're going to train for their the living skill, because there's no suitable job for them. So I think the location is totally wrong for those homeless shelter. Please considering to choose other suitable location for those people. Thank you.
The next speaker is Salim. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, yeah, I strongly support this project. It's incredibly important that we have homes for homeless people. It's really abhorrent the way we've treated them for so long, and I think it's abhorrent that people who have housing think we can take our time and helping the people who don't have housing. I hope the county ignores that direction. Thank you.
The next speaker is Neil Park McClintock. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Neil Park McClintock. I'm the president of Cupertino for All. Sorry for background noise. I'm outside right now. I'm enthusiastically in support of this project and all the work that's going into it. As the last speaker said, I think it's really important that we prioritize the voices of those without homes in this conversation. Thank you very much.
The next speaker is Alan. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Alan, go ahead.
Hello. Yes. My name is Alan. I live in the borderline of Sunnyvale and Los Altos, and I do not agree with this project because this is a very unclear about how this location is selected, and what the progress. What's the process of having this initiative? And many of my friends have no idea what is going on, and I just cannot agree with this this decision. And I hope this will be a little more transparent. And I hope we can choose some locations in Mountain View or Palo Alto, and let's have a consensus, like a voting type of a procedure. Okay, thank you.
Next speaker is Inhao Gong. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi.
Go ahead.
Hi, I'm a Sunnyvale resident. I think almost everyone here support to help homeless people, but merely through taxpayers' money to provide shelters can only make it shelterless, but no mean homeless. If there's no clear, transparent, and detailed plan from the county. We should always weigh-gain risk making decisions. The gain we want to have is to help them, but there's no information or infrastructure shared from the county about how to provide them other necessities like jobs, health, hygiene, security, food, and why the site is selected, and who are the people selected. And we are weighing an unclear gain with a very clear risk that no one is really addressing from the county. Is the county hold itself accountable for any financial cost, incident, criminal activity resulting from this plan? Is anyone voting yes share a split of this accountability if anything happened? Is all the associates support this plan, provide their share to help in addition to provide sheltering? Everyone wants to help, but there's this.
The next speaker is Amy Zhu. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hey, my name is Amy Zhu. Can you hear me?
Yes, go ahead.
Yes, I'm Amy Zhu. I'm living in Sunnyvale for more than 16 years. I oppose this project because I concerned about the community safety and the drug issue. And I have no clear guideline really about this project. Please vote no to this project. Thanks. Bye.
The next speaker is Linda Chan. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Linda, and I strongly oppose this project because, first of all, the lack of transparency. When I was living in Newark in the East Bay, all the nearby neighbors got a notice from the city that someone wants to open a bar selling alcohols across the street. So I'm appalled that we didn't get any information from the city or the county about such a big project. So that's why the fear, the insecure feeling is totally understandable.
Next speaker is Christine. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Oh, she has lowered her hand. The next speaker is Ellen. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Ellen, are you there?
Oh, yes. Yeah. This is Ellen talking. I strongly oppose this project because simply this is not engage the enough neighborhood, and there's no neighborhood voice into this project. And I do agree that two of the gentlemen who supported this project saying the people who has home should think about the people who are homeless. I strongly agree that. So why not to allocate those shelters in Cupertino downtown Main Street, where the homeless people can have easy access to food, you know, you know, it's more convenience, right? And also maybe just allocate them to Los Altos Hill, where there's more space, you know, in the neighborhood, so they can have a broad, nice neighborhood to enjoy. Thank you.
The next speaker is Christine. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Christine, are you there? I will come back to, there you go. Go ahead.
Yes. Hi. I urge you to vote no to this project because all the neighbors were not properly notified. And there are so many questions we want to ask, and so many questions remain unanswered. Like, you know, we all know that the community near this homeless shelter will be very largely impacted. And, you know, we want to ask questions like, who will be selected to live there? Are they going to have like criminal records? Are they going to have mental illness? How, you know, the safety of the residents nearby? How are you going to ensure the safety of the residents, especially the ladies living in that area? So, and the school kids, are there going to be any trouble from the residents in this home?
The next speaker is SC. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Go ahead, SC.
Hi, yes, can you hear me?
Yes, go ahead.
Yeah, I'm a resident in Mountain View for more than 10 years, and I would like to vote no, or I would like to go against this agenda because the application principles have not been clearly presented, and yet this is a 55 years commitment. And also, as others have presented, there are many other better solutions, better locations with more resources that can be retained for helping these people to get out of homelessness. So I would like to urge everyone to vote no on this agenda. Thank you very much.
Our next speaker is Yuha. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you. Hi, I'm Shu, and I'm a Sunnyvale resident living in the same neighborhood as the hotel for over 7 years. I strongly oppose this project as this is such a big commitment you asked from the community. Firstly, there's a lack of transparency on how this location is picked and when the resident is engaged. And I also have concerns on accountability on managing the property and ensuring the safety of the neighborhood. The sustainability due to high living costs in this area for low-income people is also questionable to me too. Please consider. Thank you.
And that concludes our request to speak.
Thank you very much, Colin. That was quite a job you did. I now turn back to Supervisor Submitting.
Thank you, Mr. Chair. Let me ask a couple of questions of staff, if I may, just to clarify where we are and what's before us today. Dr. Smith, Ms. Hernandez, my understanding is that the action today is simply to delegate authority to the county executive or his designee for negotiations with or in connection with Project Home Key. It does not actually commit us to a purchase on the property. Is that a correct understanding on my part?
Yes, that's correct.
Okay.
It's a resolution to delegate authority to apply to Home Key for a grant.
Thank you. And again, to confirm, Ms. Hernandez, expectation is that at our board meeting on November 2nd, there would actually be a resolution for board consideration to purchase the property. Am I characterizing that correctly?
That is correct, Supervisor Simitian.
And Ms. Hernandez, if you know, is this because it's a purchase, is this an item on our regular agenda rather than our consent calendar, and will it be at a time certain?
Yes, Supervisor Simitian, it is a public hearing, and typically it's one of the first few items you all listen to after consent.
Thank you. I see Supervisor Wasserman, our chair, nodding. If I could ask and get a commitment from both staff and the chair, if it's possible, that we will select a time certain so folks who are interested in the community, regardless of their point of view, of course, are clear about when and how they can comment on the proposal. Supervisor Wasserman, I know you've got a lot to manage on any agenda. Does that work for you as chair?
Yes, why don't we shoot for time certain of 10 a.m.
All right, thank you. I think, again, for folks who participated, by my count, that's close to 50 here. A 10 a.m. time certain means that either at or shortly after 10 o'clock on November the 2nd, the board will take the matter up, assuming everything stays on schedule. Ms. Hernandez, a lot of comment and concern about the process and opportunities for community participation. Could you recap for me, and certainly for my board colleagues and also for members of the public, the meetings or hearings that have taken place prior to today?
Thank you, Supervisor Simitian, for the question. The City of Mountain View has held 2 separate meetings to discuss the site. The first took place in January of this year, where the City Council took an action to consider a partnership with the county to acquire the property and consider it for a permanent conversion to affordable and supportive housing. So it would not be a shelter, it would be permanent housing. In April, the City Council held a second meeting where they talked about funding possible improvements up to $3.5 million. Separately, our office, in partnership with the city manager's office and their housing department, held a community meeting where we talked about the overall proposal and opportunity for Crestview. Then we held a second community meeting, and during that meeting we talked about the supportive housing system, how people are referred, our process for selecting a development partner through our qualified pool, and the process by which we would take clients from the community queue, enroll them into a housing program, and then determine if they're eligible for the property at Crestview. Next week's meeting is to pare down that referral process and share with the community step by step how people are assessed, the property management requirements that they're expected to go through. If you will, Supervisor, there's 3 different selection processes that any given client has to go through. And we hope to walk the community through that and address some of the questions that have been addressed through previous engagements, but our concept is to communicate often and in very clear terms, so that if there are questions after, they know how to reach us. Separate from that, we have done one-on-one engagements with community members. Most recently, we've been working with the City of Mountain View staff to further refine our FAQs so that we can show the community, if while they're waiting for the next meeting, where they can access information. And then post the next community meeting, presuming that there is a favorable recommendation from the board moving forward, there are 3 follow-up community engagements that would happen before the site is occupied. And then just our regular ongoing community engagement that we do for any of our properties.
Thank you. Does that mean, is the meeting that then is scheduled for the 27th, of October next week for the community. Is that the third meeting that you will have hosted then?
That is correct, Supervisor Simidian.
And today, this is our second meeting of the board where this item has been on the agenda, yes?
That is correct.
Yeah, I think, colleagues, it's, many of us over time have expressed concern about the challenge of engaging, and I use that word purposefully, the community on issues like this. It's tough. As someone who represents the area, I of course keep my eye on local news sources as well. And so putting that all together, literally in the last 9 months, 9 or 10 months, we've had, I know because I've seen them, 3 articles in the Mountain View Voice, 3 articles in the Mercury News, 2 council meetings that you just heard about, 2 community meetings that have already taken place. This is our second board meeting, and at both board meetings, I've asked that this item be on our regular agenda, not the consent calendar. And yet, with all of that, we still hear from a lot of folks that they haven't really felt fully informed or engaged or even aware of the pending developments. And I think, and I believe them, just to be clear. And I think that speaks to just how challenging it is in a diverse and busy community to get people's attention until the 12th hour. It's a riddle we're going to have to solve at some point here, but it seems to be a constant challenge. And I think anything we can do to do ever better is to the good. I do want to underscore something that Ms. Hernandez said. Ms. Hernandez, just so we can make this very clear, while there are still outstanding questions, and I want to get to those about the use of the site if the county moves forward, it is not being proposed as a quote unquote homeless shelter. Do I have that correct?
That is correct, Supervisor Simidian.
Okay, and I've been involved, as you know, with your help, in fact, in citing a couple of shelters in my district, but I do think it's important in this case that people understand that's not what is proposed here. I should just mention for the record that I have visited the site on my own and walked through the common areas. I've also visited the neighborhood and both walked and driven in the neighborhood to get a sense for what the context was and what the location was. And I want to get next to this issue of questions that have not yet been resolved or in the view of some at least answered, Ms. Hernandez. We got a little bit of a catch-22 here, which is we can't get answers to questions until we know who our development partner might be if we go forward. But we don't get to the point where we have a development partner unless we move forward. Is that the place we're caught at the moment?
Actually, Supervisor Simidian, we've been doing a lot of work in the interim since our last community meeting, looking at the data in Mountain View to understand what the needs and gaps are in that community and in North County. Also looking at the competitiveness through home key. And so we are very close to finalizing our proposal so that we can share that with the community next week before we formally submit our application. We do have a number of options. And that's part of our presentation to the community, where we are looking at families, possibly youth, but it will depend on how the unit, you can put 2 single units together to create a 1-bedroom unit. And so that's part of what we hope to share with the community next week before we formally submit the application to the state. And our development partner would receive that information as part of our packet to them when they respond to our request. So we get to dictate basically, Supervisor, who we prioritize.
How confident are you that whatever you share with the community on the 27th is both what you'll bring to our board on the 2nd of November and then will be acceptable to and implemented by our yet to be identified development partner.
Thank you, Supervisor Submitting. That's a great question. I think that's a challenging one to answer. I think it's always hard to assuage all of the concerns raised by the community. As you know, anything related to unhoused individuals that have experienced, whether it's episodes of homelessness or chronic homelessness, that concern stays. Even when we talk about the supportive services, the case management, resident services. So I think we'll be able to definitely answer the questions, whether that will address the primary concerns or assuage those concerns from the community. You know, it's like any other affordable and supportive housing. It's unknown until we're in it.
I'm not so much concerned or asking about the ability of the answers to assuage the concerns as I am asking about how firm the decisions will be. One of the places where I think we get into trouble with the community is if we say one thing and do another. And sometimes circumstances change or we get new information and necessarily adjust, adapt, change. But I think from the community perspective, you know, that has the potential to do a lot of damage in terms of our credibility and therefore acceptance in the community if we don't have answers that we can say, this is what we're doing and we mean it and we'll keep our commitment. Or in the alternative, say, this is our current plan, it could change. So I'm just trying to get a sense for, well, let me put it this way. I would encourage you at the community meeting on October the 27th to make sure that you're able to distinguish between things which are more or less rock solid commitments or certainties and things which may be subject to change, and, you know, not make, and I know you wouldn't ever do it deliberately, but not make commitments that we can't really ensure or honor as we go forward. Forgive me, I'm trying to make sure my battery doesn't run out. Here we go. I don't think I have any other comments or questions at this time, Mr. Chair. For the delegation, which is the only action that we're taking today, I am prepared to move the staff recommendation, but with specific direction that this item come back to us on a regular agenda at a time certain when it is heard by our board.
Thank you. I appreciate that. Supervisor Lee, do you want to second that and then speak?
Yeah, I'll second that. I do have some questions for staff as well.
Fire away.
Thank you. There were, so first of all, the question is for the Office of Support Housing, Consuelo here, regarding these home key projects. So first of all, I know there's some deadlines coming up for the home key projects, right? So what's the next deadline in terms of applying for funding, or is it just a matter of when the funds runs out at the state level?
Yes, Supervisor Lee, the second wave of funding recently opened. I believe September 30th is the official opening date of the application intakes. And they will disperse funds on a first come, first basis. And there's a geographic distribution that we're basically competing with amongst the different Bay Area communities.
Okay, all right. So we don't have a hard deadline when it is, but certainly the sooner you apply, the higher the chance of getting the funding, right?
That is correct.
Okay, all right. Now, on the other type of home key projects, obviously we have security being provided in those projects. Could you elaborate a little bit more what type of security may be provided in the situation of Crestview Hotel?
Sure, thank you, Supervisor, for the question. There's different levels of security. The property management company and the development partner that we select will include resident services. And so this is somebody that's stationed at the front desk. Their job is to build community, address any concerns that might happen in the property. And then in most cases, there are limited security that is provided, particularly to prevent people from the outside coming in and trespassing into the property. And the level of security and that budget is part of what we would look to our development partner to build out. And what we've done is looked at similar size projects to see what they provide in the way of security. But again, the intent there is typically to ensure the safety of the residents that are living on the property.
Okay, now when it comes to be residents, there's a process of applications. In other words, not anybody can become residents. There's a whole process and background check and whatnot. Could you elaborate how that works?
Sure, there's 3 different layers of tenant screening, Supervisor. First, they have to be enrolled into the program depending on the population that we propose to serve there. And then if we are using, for instance, project-based vouchers to support the units, there are certain things that are ruled out. For instance, somebody that has criminal background history is automatically eliminated from that voucher program. And so they wouldn't qualify there and they wouldn't advance in the process. If they don't have that background, then they make their way to the property where a property manager vets their application for meeting the criteria of the property. So there's multiple layers of processes that have to take place before somebody's actually housed.
Thank you. Now, there's quite a few things. I'm just trying to go through my own notes from all the comments from many of the speakers. So I want to make sure we get those covered. And I just want to make that very clear because some of the speaker was opposed to a homeless shelter. And I keep hearing that word, but clearly this is not like what we have at Hamlin Court. That's a homeless shelter. There is no plan whatsoever that this will become a homeless shelter, correct?
That is correct, Supervisor Lee. The intent is to convert the hotel into permanent housing.
Right, and these are permanent housing, meaning that people will stay there for years, technically speaking, permanent, not days or weeks, correct?
Correct. They will have a lease. Typically, the lease is an annual lease. We go through a recertification every year to ensure that they income qualify, but it is permanent housing.
All right. And then the other thing is there will be rent being charged. These are not free housing, correct?
That is correct.
Okay. All right. You mentioned the options of family. Can you elaborate that a little bit more about the family and youth proposal of the options of how we could potentially make this into housing for families?
Sure. So currently the hotel is a 66 unit. Once upon a time, I think one of the speakers mentioned that the property has had a number of owners manage the site. One of them removed the kitchenettes that were originally in the units. So part of the rehab work would be to put back the kitchenettes. And what we're looking at is rather than removing certain walls, bringing 2 of the units together to create a 1 or a 2 bedroom unit. That would accommodate a small family.
Right, great. Yeah, and I certainly would want to make sure that options is clearly made available during the next report coming back to us. That would be very helpful. And that's all the questions I have for now. Thank you.
Thank you very much. So we have a motion by Simidian, a second by Lee. I've got some comments. Supervisor Simidian.
Thank you, Mr. Chair. I apologize. I just wanted to correct the record. I misspoke. I was looking back through my notes of the meetings when I said that we pulled the item off consent at the last meeting. We did not. It stayed on consent, but I did take the matter up for comment before we acted on the consent calendar. I just didn't want to leave the record incorrect once I realized my error. Thank you.
Thank you very much for getting that right. Consuelo, I've got to tell you, I listened to 49 people speak. I heard about at least 4 other public meetings that have taken place regarding this item. I know notifications went out around the neighborhood. And what I just heard you and Supervisor Lee say, I think is paramount of importance when your next notice goes out. if you could include 3 bullet points that, and say it however it is appropriate to say so, okay? But that what is being proposed is permanent housing with 1-year leases. And I'm just saying this, and you put it a nice way, okay? But permanent housing with 1-year leases, applicants cannot have a criminal record, and whatever else you wish to say. Because what this really sounds like is somebody misinformed, or perhaps informed and opposed, and word got out, and then it spreads like wildfire. And I'm not saying that any of the people that spoke today had heard about this before. And if somebody's heard about it and said they haven't heard about it, that's their choice. If somebody's in favor of it or against it, that's their choice. But I think there's a real misunderstanding just based on the repetitiveness of the messages that were read today. We've all been in this political game long enough to know that many of what was said today was duplicative. And many of those items that were listed, I've learned from you, Consuelo, are simply not true. This is not a homeless housing, as Supervisor Simidian described before, as barracks with concrete walls and you throw your mattress down. I think that's a huge distinction. That's all I've got to say. If there's nothing more to say, we've got a motion and a second, and I'll ask on Colin to call for the question.
Supervisor Lee.
Aye.
Supervisor Chavez.
Yes.
Supervisor Simidian.
Aye.
Vice President Ellenberg.
Yes.
And President Wasserman.
Yes, as well. Thank
you.
you all very much. And unless there's another hand going up here, we are going to adjourn this meeting today at 2:53. And I assume, what are we calling the first week of November?
Oh, let me see here. That is, I have to scroll
November
through.
2nd.
Did November 2nd, did my vice president say? There we go.
I'm not
That's
your
correct.
vice president, but yes, it is.
Rhonda said it.
Rhonda.
She
It's
gets the
Rhonda.
credit, but I nodded in agreement.
Yes, you did. All right, November 2nd. Thank you, Rhonda.
I
Thank
just
you.
didn't want to take credit for being vice president. That was all.
Hey. No worries at all. Thank you all very much, my friends. And I
Recording stopped.
adjourn this meeting. Thank you.
Thank you all. With that, this room will be closed. Have a great day.